Thanks, man.
Okay.
How
you doing? I can see your smile.
Yeah, good, good. Oh, this guy? Yeah, this is leftover from drywall work. Yes, sir. Yeah. Yeah, exactly. Yeah.
Louisiana, Mississippi, Alabama, so hopefully we'll continue on here.
Okay. But let me know when you're in town.
Absolutely.
Sooner or later, we're going to have some landfall of depression out there now.
There's a couple out there in the Gulf.
Morning. Hey, honey. How you doing, Kathleen?
I just want to say hi.
Good morning, ma'am. How are you?
I'll just, they can't do that.
We'll do that. How are you? All right, very good.
Yes,
ma'am. Nice to meet you.
We're about, excuse me, Ms. Jackson, we're about to start. 5, 4, 3, 2, 1. The Committee on Homeland Security will come to order. The committee's meeting today received testimony on examining the national response to the worsening coronavirus pandemic, Part 2. Without objection, the chair is authorized to declare the committee in recess at any point. To remind members, we are following the attending physician's guidance on wearing face coverings at all times while not under recognition, and the chair will only recognize those who are following the guidance. Today, the Committee on Homeland Security is meeting for Part 2 of our hearing to examine the national response to the worsening coronavirus pandemic. 2 weeks ago, the committee heard from state and local officials about how the Trump administration's failure to respond to the pandemic has harmed their communities and our nation. We invited FEMA Administrator Peter Gaynor to that hearing, but he declined to attend based on White House guidance prohibiting administration witnesses from appearing before Congress remotely. To be clear, that self-imposed guidance is intended to undermine congressional oversight of the administration, but the committee will move forward with its work today. I would note that the committee also invited the Department of Health and Human Services to participate in this hearing. HHS refused to send a witness, even though the committee scheduled this in-person hearing to accommodate the administration's request. That refusal is yet another example of the Trump administration shirking its responsibility to answer to Congress and the American people on its bungled response to COVID-19. That being said, we're pleased that Administrator Gaynor is here to respond to members' questions about the pandemic, which has scheduled this in-person hearing to accommodate the administration's request. That refusal is yet another example of the Trump administration shirking its responsibility to answer to Congress and the American people on its bungled response to COVID-19. That being said, we're pleased that Administrator Gaynor is here to respond to members' questions about the pandemic, which has now claimed lives of over 140,000 Americans. The number of U.S. coronavirus cases continue to surge, with 60,000 new cases just yesterday. The country also recorded more than 1,000 coronavirus deaths in a single day yesterday, for the first time in July. Nations around the world like Canada, Australia, Japan, Korea, and many in Europe have managed to bring their outbreaks under control through coordinated responses, consistent messaging, and measures such as face covering, testing, and contact tracing. But here at home, the Trump administration's response to the coronavirus has been an abject failure, and the American people have suffered the consequences. The president's gross incompetence and incoherent plan to respond to the pandemic has cost lives. South Korea reported in its first COVID-19 case the same day as the United States, but we have suffered 470 times the number of deaths they have. Tragically, in many ways, we are no more prepared now to address the pandemic today than we were at its outset. We still have a shortage of medical supplies and equipment like masks, gowns, and gloves. Wait times for COVID-19 tests results are climbing, and most alarmingly, there's an urgent demand for ICU beds in states where the virus is spinning out of control. Doctors and nurses in the greatest country on earth should not have to plead for the essentials they need to save lives and protect their own. Just yesterday, months into the pandemic, after repeated calls for face coverings from doctors and scientists in his own administration, the president finally called on Americans to wear masks. We are hoping that in an this is an indication that President Trump may, at long last, be willing to take the advice of the experts on responding to the pandemic. We need real leadership at the federal level if our country is to overcome the COVID-19 pandemic and prevent more lives being lost needlessly. Administrator Gaynor and his agency have a Herculean task ahead, in many ways, made all the difficult by the President himself. Today, our hearing is not about blaming China for the Trump administration's failure to take care of its own people. Frankly, we do not have time for such ridiculous attempts to distract from the crisis at hand. Instead, I hope to hear from Administrator Gaynor today about where we currently stand and how the administration can improve its response to the public health emergency. The American people are counting on us. I thank Administrator Gaynor and my colleagues for participating in this hearing today. The chair now recognizes the ranking member of the full committee, the gentleman from Alabama, Mr. Rogers, for an opening statement.
Thank you, Mr. Chairman. I'm glad we're finally meeting in person. Our experiment with virtual hearings hadn't gone all that well. Nearly everyone was marred by technical issues that caused prolonged delays and frustrated members on both sides of the aisle. Going forward, I hope we'll continue to have these in-person hearings. Doing so improves our productivity and facilitates participation by administration witnesses like Mr. Gaynor. I understand your frustration with the administration's restrictions on appearing at virtual hearings. That's why I appreciate your working with FEMA to facilitate the administrator's in-person testimony today. As I said before, our hearts go out to those who have lost their loved ones to COVID-19 and those who are currently undergoing treatment. COVID-19 is an unprecedented global pandemic that requires an unprecedented response. Unfortunately, the administration's response effort was undermined from the start as China hid the disease from the world. The Chinese Communist Party hoarded life-saving medical supplies while they encouraged foreign travel, seeding the virus across the globe. Facing an extraordinary public health crisis and China's deadly cover-up, the Trump administration has responded with a whole-of-government response. Since March, FEMA has helped lead the response effort. The agency has coordinated the delivery of over 20 billion items of PPE to medical personnel, emergency responders, and critical infrastructure workers. Administered 56 major disaster declarations covering every state and territory, and obligated over $145 billion to support federal, state, and local response. While those efforts should be commended, more hard work is ahead. The number of positive cases continue to rise, and hospitals in some areas are reaching capacity. Demands for PPE and response funding from FEMA will continue to grow. I'm interested in hearing from the administrator about what our states need, where the bottlenecks exist in supply chain, and whether our domestic manufacturing capacity for PPE and medical supplies is sufficient. As hurricane season heats up, I'm also interested to hear FEMA's plan to deal with the COVID crisis while managing response to major natural disasters. Our country has faced outbreaks of serious disease in the past. In each case, we have marshaled our collective resources and ingenuity to overcome the crisis. I'm confident that will be the case with COVID-19. Thank you, Mr. Chairman. I yield back.
Other members of the committee are reminded that under committee rules, opening statement may be submitted for the record. As you know, most of our committee room is too small, and that's why we are meeting here in the Armed Services Committee to accommodate the full committee. And I thank them for allowing us to use their committee room. Members are also reminded that the committee will operate according to the guidelines laid out by myself and the ranking member in our July 8th colloquy. I welcome our witness. We have with us here today the Honorable Peter Gaynor, FEMA Administrator. Administrator Gaynor was confirmed by the Senate on January 14, 2020. Prior to his current role, he served as acting administrator for 10 months and was previously confirmed to serve as FEMA's Deputy Administrator in October 2018. Administrator Gaynor previously served as the director of the Rhode Island Emergency Management Agency. Before his emergency management career, Administrator Gaynor served in the United States Marine Corps for 26 years. Without objection, the witness's full statement will be inserted in the record. I now ask Administrator Gaynor to summarize his statement for 5 minutes.
Good morning, Chairman Thompson, Ranking Member Rogers, and distinguished members of the committee. My name is Pete Gaynor, and I am the FEMA Administrator. Thank you for this opportunity to discuss the actions taken by FEMA to protect the health and safety of the American people during the COVID-19 pandemic. On behalf of the men and women of FEMA, I would like to begin by offering my condolences to the loved ones of over 142,070 Americans who have lost their lives to COVID-19. One life lost is one life too many, and our hearts go out to all those that have been affected by the pandemic. This has been a trying time for our country, and FEMA has been working around the clock to help our nation respond to this historic global pandemic and other natural disasters. As the FEMA Administrator, it has been my honor to work alongside the dedicated professionals of FEMA. Today, I want to acknowledge that workforce and our many partners for their commitment to the nation during this response. This response continues to be one that is locally executed, state-managed, and federally supported. President Trump made the unprecedented decision to declare a nationwide emergency on March 13th, and since that time, the entire team has worked tirelessly to make a positive impact, and many have risked their own health and safety to do so. For the first time in American history, we have a major disaster declaration in every state, territory, and the District of Columbia in one tribe concurrently. Today, FEMA is responding to 114 active disasters and 97 emergencies. The magnitude of this pandemic has required us to re-examine our past practices and to keep up the risk to our staff as low as possible, all the while refusing to fail in meeting our mission. COVID-19 has been a global crisis, with most countries competing for the exact same medical supplies. Every government across the nation has been competing for the same resources, such as personal protective equipment, or PPE. To further complicate matters, most PPE is made in Asia, where the virus significantly slowed manufacturing and where U.S. law has limited authorities. During more common natural disasters, FEMA typically manages an abundance of resources for disasters that are limited in geographic scope and impact. In responding to COVID-19, FEMA has met a more difficult task of managing the lack of critical medical supplies and equipment. Rather than managing resources, we are managing shortages. We have worked tirelessly to find medical supplies and equipment across the globe and rapidly move them to America. We quickly prioritize resources to ensure that locations with the highest risk of COVID-19 cases and deaths would not be in danger of running out of supplies and life-saving equipment. Using the HHS Strategic National Stockpile early on, it became clear that the scope and scale of this pandemic went far beyond what the stockpile was designed for. It could not be relied upon as the single solution for pandemic supplies in the United States. To address these widespread shortages, the Supply Chain Stabilization Task Force was swiftly assembled by FEMA and its federal partners. In less than 10 days, we established an air bridge to expedite critical supplies already purchased and owned by some of the nation's largest medical distributors, with the goal of providing temporary relief until supply chains could begin to stabilize. Our goal was to supplement, not supplant. This air bridge cut international shipments from 37 days by sea to just 1 day by air. From March 29th to July 1st, we have completed over 249 flights carrying life-saving supplies to the American public. In addition to expediting supplies into the United States, the federal response has focused on stabilizing the lives of Americans in many impactful ways. Since March 13th, we have provided over $8.4 billion in obligations to states for COVID-19 related activities, with the first $1 billion obligated in just 11 days. Another $1.7 billion has been allocated in support of Title 32 National Guard troops, as well as the deployment of 5,300 DoD Title 10 medical professionals who have provided critical medical support to numerous hospitals under stress. To further bolster the medical infrastructure of our country, FEMA, through mission assignments to the U.S. Army Corps of Engineers, constructed 38 alternate care facilities and deployed 41 federal medical stations. As part of the administration's testing blueprint, FEMA has procured and delivered more than 41 million swabs and 32 million units of media. While we continue to respond to COVID-19, We want to ensure that we are using all our available assets and resources to address these critical shortfalls. To do so, the federal government has utilized the Defense Production Act to increase the amount of medical equipment manufactured domestically to ensure our nation's future preparedness is not overly reliant on foreign producers. This increase of domestic manufacturing will also allow FEMA to pivot towards hurricane season preparations as well as other natural disasters. As part of this pivot, FEMA recently released a planning guidance for the 2020 hurricane season to help local officials best prepare for more common disasters within the context of a pandemic. The operational guidance is scalable, flexible, and functions as an all-hazards planning document. Regardless of the challenges FEMA will continue to confront, the bedrock of our mission remains constant: to protect the American people before, during, and after disasters. And the framework by which we accomplish this remains unchanged. Responses are most effective when they are locally executed, state-managed, and federally supported. The nation is counting on us to accomplish our mission, and we will do so in accordance with our core values of compassion, fairness, integrity, and respect. This unprecedented response to the COVID-19 pandemic will continue to require a whole-of-America effort, and FEMA looks forward to coordinating closely with Congress as we work together to protect the lives of the American people. I would like to thank the committee for authorizing the many resources necessary for FEMA to meet these historic mission requirements and for the opportunity to testify today, and I look forward to your questions from the committee today. Thank you.
I thank the witness for his testimony. I remind each member that he or she will have 5 minutes to question the witness. I will now recognize myself for questions. Mr. Gaynor, can you talk to us about why a lot of members in Congress are still hearing from hospitals that they are short on PPEs?
Yes, sir. And I can't talk to specific hospitals, but I'll just talk generally where we are with the pandemic. And just, for context, this is a global pandemic. And I said in my opening statement that every country that has COVID-19 disease in their country, to include every governor and mayor, tribal chief in the United States, is looking for the same exact PPE. We don't make it here in the United States. We make very, very little. We make virtually no rubber gloves in the U.S., as an example. We are in competition still for PPE around the globe. The place we are in today is much better than we were 60 days ago. Although we're not going to buy our way out of this with just money, we're going to have to improve the industrial base to make these critical items in the U.S. so we're not at the whim of our global competitors. We have talked to every single state director, emergency management director in the country, and got a feel for what they have in stock in states. It's actually pretty positive. 60, 90, 120 days, states have stockpiled today. Now, there may be shortages, micro shortages across the country based on COVID-19 cases, increased hospitalizations, and those hospitals or those frontline workers that have a shortage should work with their local emergency management director, their local public health director, and identify those to the state and then obviously to us so we can fulfill those requests.
So your testimony is that all a hospital has to do to get the requisite requirement for PPEs is talk to their local emergency manager.
There's many different ways to do it. That's one way. The commercial medical grade PPE distribution is very healthy today. So if they can't get it via their normal supply chain, there's 6 big medical distribution companies in the country. If they can't get it there, we can help. We have insights through our supply chain
my
control
point
tower
is
to help those hospitals or who else may have a shortage.
My point is that it's still a problem. And can you provide any written direction to the committee as to how you suggest they can share with their constituents how they can get access to more PPEs if required?
Yes, sir. And I want to be clear. We have a ways to go on making sure we have enough PPE. This is not as simple as just throwing a light switch and we just magically make more. We still have many months to go before we start making enough on the U.S. to supply the demand. And as cases grow in the Sun Belt, demand goes up. But if there's a hospital or a tribe or a county, city that needs PPE, contact their local emergency manager to go to the state and obviously to us so we can fulfill that or address that through either federal supply or commercial supply.
Well, I'm glad to hear that because it's still part of what most members here in their district. Moving forward, last week our nation topped 75,000 new cases of COVID-19 in a single day for the first time. We have 4% of the world's population, about a quarter of all deaths in the world from COVID-19. Clearly, our national response to the pandemic has been woefully inadequate. When we held part one of this hearing on July 8th, Governor Pritzker of Illinois, Mayor Shelton of Tupelo, and Dr. Shaw of Harris County Public Health in Texas all said that inconsistent messaging is severely hurting our ability to respond to this crisis. Does it help FEMA's response effort when the president repeatedly says things about the coronavirus that are not accurate, such as he did Sunday when he claimed that the coronavirus is going to disappear?
Sir, my role in the administration is to make sure that I focus on leading federal operational coordination, making sure that all the things we need to overcome COVID-19, whether it's rising cases, hospitalizations, need of staff, PPE, pharmaceuticals, beds. My role is to make sure that every request from every governor, from every mayor, from every tribal chief is fulfilled to the best of our ability based on what we have. That is my role in fighting COVID-19.
Thank you. But consistent messaging, all the experts say, is important if we're going to get through this and get over this. Let me ask you this. Has FEMA ever been directed by anyone at the White House to procure supplies from any source?
No, sir.
Well, I want to put on the screen a contract that between FEMA and a contractor that FEMA provided us upon request, and the procurement of N95 model RP 88018 and RP 88020 respirators, it says ordered, directed by the White House. And you all provided that to us. So what I want you to do, if you can't explain it now, because part of the conversation we've been hearing is that agencies have been directed to do certain things and use certain contractors. And you've said it haven't. I've provided you with documents that you provided us. And I just want you to go back and check your people to make sure that you're not saying something that is not true from FEMA's perspective.
Well, I'm absolutely confident what I just said about not receiving direction from the White House is absolutely 100% true. That document that we provided is really an administrative note by one of our contracting offices where we got many different inputs from where we could find supplies from COVID-19. I received, at the high point, 50 emails a day from people trying to offer me PPE where we could buy it, all pushed into the system. I received phone calls from mayors. I received phone calls from governors about a local producer had PPE. I received information from the vice president and the task force where people would call them hospitals to say, hey, I know of a PPE provider and look into this. And so that's a reflection of just where or where we got all sorts of information from everyone. I get calls from senators and congressmen saying, hey, I have a person that produces PPE in my agencies. Can you put that into the contracting chain? That is a reflection of just that. Thousands and thousands of unsolicited requests from many different people around the country trying to be very helpful, and it comes from all different directions. The gap between somebody offering a supplier, whether it's true or whether they don't have anything. They're just trying to. And the gap between us contracting, and I said it before, is as wide as the Grand Canyon.
I understand, but I want you to look at it, that particular information, and after you have, get back to us and say, it was exactly what I said, and I'm fine.
Sir, I've looked at it. I'll tell you right now, I'll save you the time. It's exactly what I said it is.
Okay, thank you. I yield back. Chair recognizes the ranking member of the full committee.
Thank you, Mr. Gaynor, for being here. As you know, hurricane season began June 1st, and the chairman and I both represent states that are on the Gulf Coast, and hurricane season is a big deal for us. Is FEMA capable of managing COVID-19 response in the hurricane season simultaneously?
We are, sir, and I have stated publicly before, I don't think FEMA has been more ready than we are today. We have not only dealt with COVID-19 response, ongoing response, we have dealt with flooding in Michigan. We've done dealt with earthquakes in Puerto Rico. We've dealt with tornadoes, and we are completely ready for the hurricane season. Early on, after we were tasked by the president to provide or or take over the lead for federal operational coordination, we knew we were going to be in hurricane season. And so we drafted a plan called the COVID-19 Pandemic Operational Guidance for the 2020 season. This was done and issued on May 20th. We did this in 21 days. We took all the lessons learned up to that time about how to integrate, respond to COVID-19 and the hurricane season. This is actually, you could use this for any hazard, so whether it's wildfires or flooding, the lessons learned in this apply to all hazards across the country. We want to make sure that jurisdictions look at their existing plans about evacuation and sheltering and apply the lessons that you're going to need to apply that we've learned in COVID-19. You're going to need more time. You're going to need more space. You're going to need to do more cleaning. All those kind of things you're going to have to, again, I was a local emergency manager in a city and I was a state emergency manager. You're going to have to go through all those plans to make sure you update those so you're ready for whether it's a hurricane or tornado or a wildfire. We provided some planning guidance across the nation to make sure that not only the federal government is ready, but our partners, locally executed, state managed, and federally supported. It's a team effort. It all has to work together. And of course, we need our citizens to be ready for disasters also. So it's all of community effort.
Do you find those local partners being willing to participate in a cooperative manner with you in trying to prepare?
I missed the word, sir.
Do you find that those local governments are cooperative partners?
Yes, sir. We just came back from a road trip to the Gulf Coast last week. I spent a significant amount of time in Baton Rouge, Louisiana, New Orleans, Mississippi, Gulfport, Mobile, Alabama, and checked on local and state preparedness for the hurricane season and how they're doing on COVID-19. Many, if not all, of the emergency managers that I talked to include governors, have taken these guidelines under consideration and are making and have made preparations for a hurricane season to make sure that they're completely ready, not only for a hurricane, but a hurricane while responding to COVID-19.
You know, the chairman was talking to you about PPE and some of the shortages that we've experienced. You know, we know that China has been a primary source of production of PPE, and I think you're going to see our country move away from that in the future. But my understanding from your responses to the chairman's questions is you feel like that we now have found alternative sources that are sufficient for this kind of equipment going forward. Is that accurate?
Like I said before, we're in a much better place than we were coming out of March and April. However, we are not out of the woods completely with PPE. Again, the majority of PPE is made offshore. China, Malaysia, Vietnam. And so one of our efforts early on with the supply chain control stabilization force was to accelerate that PPE to the United States. take preservation methods to, or measures to preserve PPE that we had, and to increase industrialization in the United States through the use of the DPA. All those things have happened. They continue to happen. We are producing N95 masks in the U.S. We need to produce other items. And through our partnership with the federal government, DOD, DLA, and many other partners, we are working towards that. But it is not a light switch. It is more of a rheostat, and we have some distance to travel.
Great. Thank you. I yield back, Mr. Chairman.
The chair now recognizes other members for questions they may wish to ask witnesses. I will recognize members in order of seniority, alternating between majority and minority. Members joining the hearing via WebEx are reminded to unmute themselves when recognized for questions and to mute themselves once they have finished speaking, and to the extent practicable, to leave their cameras on so they may be visible to the chair. The chair now recognizes the gentlelady from Texas, Ms. Jackson Lee, for 5 minutes.
Chairman, I thank you very much for this hearing, and I thank the ranking member for his presence here. We are at such a catastrophic crisis in this nation that however we are able to come together, Mr. Chairman, I'm appreciative very much, virtual and or in person. Americans are dying. They're dying. I don't know how many times I need to say this. They are dying, and our hearts are broken. 144,000, and the number is growing. Administrator, I do want to thank the hardworking FEMA employees and contractors and others. Thank you for your embedded commitment. You are a man that deals with crisis, and that's your work, and I think it's your passion. I'd appreciate it if you give me yes or no answers because my time is limited. I come from an epicenter, and I'm dealing with my colleagues across the state. Congressman Gonzalez has indicated if you can help them in Hidalgo County, and they are short of oxygen, you can contact Judge Cortez and Dr. Melendez. They have no oxygen. People are dying. My colleague, Congressman Villa, please contact Judge Trevino. They would like another super testing site. They have no morgues and crematoriums. People are dying. Congressman Gonzalez said that 500 to 600 people a week are dying. In my own district of Harris County, the numbers now are extreme. People are dying. And it is crucial that we know that Texas has almost 5,000 dead. It has 58,000 cases in Harris County. In Houston, there are 83,000 cases, and just in the last 24 hours, 784 dead. My question to you is that when the national declaration was declared of an emergency, did you get handed a strategic plan for the nation dealing with testing and dealing with masks? I just need yes or no. Did you get a plan handed to you from the White House?
Are you talking about from the very first day?
Yes.
No, but we had an existing pandemic.
Mr. Administrator, let me.
I know, ma'am, and I want to be respectful.
You can finish with a sentence,
It deserves
sir.
more than a yes or no answer. We had a plan that was updated in 2018 called the PANCAP plan, the Pandemic Crisis Action Plan. That plan was updated on March 1st to work into what we're seeing with COVID-19.
And I thank you very much.
So we had a plan, yes, ma'am.
You had a plan March 1st. We discovered COVID-19 on October 2019. I don't want to hold that to you, but that was testimony in this committee by another member of the administration.
The PANCAP plan was written and updated in 2018.
Thank you. But that plan you did not get when you were handed the responsibility of supervising COVID-19. Despite concerns from local officials that a lack of federal testing support could cause further spread of the virus, in late June, the Trump administration confirmed it would no longer provide funding for 13 sites, including sites in states like Texas, which are experiencing rises in confirmed cases. Only 2 sites in testing have been extended until the end of July. Every medical expert says testing is diagnostic. I'd appreciate it. 2 questions. Why are they cutting sites? And in that, I'm requesting that the National Guard be continued past August 31st, or at least until August 31st, to continue our testing sites. And then I want to understand, in your plan, did you give states the urgency of the need for stay-at-home orders. As you well know, there was a White House task force report that was hidden and kept from states in terms of members or local authorities. My local mayor did not have it. And in that report, moving down to that report, it indicated that Bexar County and Harris County were hot spots and that we should rewind back on our opening. Did FEMA get that report? Was there a reason why that report was kept? And should we now be rewinding in these hot spots because of that report? Mr. Administrator.
Yes, ma'am. So let me try to answer what all your questions are. First, on the community-based testing sites. When we first started community-based testing sites, we call them 1.0, the first version of that. There are 41 of those across the country, run and funded by the federal government to really get testing started in the local community. That has morphed into, we're in version 3.0, where there's more than 700 testing sites across the country. Most of those now accessible in places like Walmart, Walgreens, CVS stores, Kroger's, where anyone can walk up and get a test. To the original federal testing sites, it was not an issue about stopping funding. It was really about an issue of passing control and running the administration of those testing sites to states. Still running today. Some of them, I think the last 4 in your district. I know you and I have had conversations about keeping those running because they're important to your community. We have adapted since the beginning, and I think this is why we've been successful. We adapt as we go because we learn new things, and so I think testing sites is really a testament to how we adapt to the testing need. On the National Guard extension, I think we've already had 2 extensions. The most current extension runs out on August 21st. That extension is up for consideration. We spoke about it. I spoke about it with the president, the vice president, the coronavirus task force. There's not a week that goes by where I don't have a conversation with the governor about extending it. That will be, I believe, the administration. We're talking about all that. I think in time you will learn. We will learn what the decision is on that. But I have confidence that the National Guard continues to provide critical support to governors across the country. At the high point, 40,000 guards, men and women across the country, providing all sorts of support. And you know the kinds of things that they do in your community. We need them to continue while we battle COVID-19. The last one, I believe, was the stay-at-home orders. Well, the federal government doesn't issue orders to governors, states' rights. I think what we provided to governors and mayors and tribal chiefs is guidance. Here's the best guidance, CDC guidance. And you know, I've learned a lot in my role on the coronavirus task force. I was talking to Dr. Fauci the other day, and there's some fundamentals that we all have to do. Wear a mask, socially distant, stay away from large crowds, you know, don't go into bars, and good hygiene. If we do those 4 things, we can continue to crush COVID-19. So again, we want to make sure that, you know, whatever, because every state is different, every locality is different, locally executed, state managed and federally supported. My role is to make sure I support those state governors and those local elected leaders if they have a resource deficit.
Gentlelady's time has expired. Chair recognizes the gentleman from Louisiana for 5 minutes, Mr. Higgins.
I thank the chairman for holding this meeting and the ranking member, and I thank our witness for joining us today. The supply chain has been brought up several times by my colleagues on both sides of the aisle, and I agree. One thing that's become very apparent during this pandemic is that the United States' reliance on overseas foreign countries, most notably China, where this virus originated, let us remember, to provide important medical supplies, PPE, et cetera. I would argue many other items is very apparent. We have to change this. Much has been done by the president's administration to bring manufacturing work back to the United States. I think we need to take a deep look at our supply chains and bring back the capability to produce domestic products of strategic importance, such as medical supplies or food security. I would argue we're not just talking about China. We have to consider transit across the Pacific, where we can't quickly or efficiently bring supply chains back to the United States without making the determination to do so. And we have to have the courage and the will in Congress to make those moves. And from the executive branch, we need action, as we have seen out of President Trump's administration, to bring manufacturing back to the United States, ending our reliance on overseas nations for our medical supplies and focusing on sources that exist or can easily be produced regionally should be a top priority of Congress. Administrator Gaynor, do you agree with the premise of what I just stated, sir, regarding shifting to regional supply chains? That would include not just manufacturing in the United States proper, but using our reliable partners in the Western Hemisphere, especially Mexico and Canada, through the new USMCA agreement. Would you agree with that assessment?
Yes, sir. And I think just in a more general sense, and we have to. This is a national security issue, PPE, and we've seen how critical that is to protecting lives and minimizing suffering. So we are on a path to increase U.S. production in the U.S. The recent CARES Act provided $1 billion under Title III to bring some of these resources back to the U.S. So investments in test kits and reagents, N95 masks and PPE, prioritized pharmaceuticals, vaccine delivery systems, and supply development are all initiatives that are underway in partnership with our DoD comrades and DLA, Defense Logistics Agency.
Yes, sir. And thank you for that thorough response. Obviously, we're still in the middle of this thing, and the strategic steps we need to take to be ready for future pandemics, that becomes increasingly clear as we continue to progress through this current challenge. My question now to you, sir, is are agencies right now looking at what regional assets are available in North and South America, especially, again, our USMCA partners, to supplement and eventually replace our dependence on medical supplies and other strategic products that are currently being produced in China and elsewhere? Are you identifying strategic, capable locations and facilities with our reliable Western Hemisphere trading partners to replace the threat we have now? They could they could just turn the valve off, or we could have some sort of a challenge that would restrict us from crossing the Pacific. Are you identifying these assets now in the Western Hemisphere?
So I can't speak to any specifics because it's really not in my current roles and responsibility. But I know generally, just because there are conversations going on in the administration, the Supply Chain Task Force, and other places, that we are looking to maximize onshore production of PPE and any other safe and resilient partner we can. Again, I would have to defer to Defense Logistics Agency or DoD about how far they've gotten on some of those initiatives.
Right. Well, you're part of the administration that has taken historic actions to respond to this pandemic, and that means you're in the room. And so you certainly, although this might not be the specific role that you play according to your job description, do you have a sense from the executive that we are looking beyond the scope that we've been restricted to by previous administrations, and let us not focus on the Obama administration or the Bush administration. This reliance on foreign production of important and strategic products has happened over the course of decades, and President Trump inherited that. It's being changed greatly now in response to this current threat. Would you generally agree with that? To answer that question, and I yield, Mr. Chairman.
Yes, sir. I think generally we are looking under every rock. We're turning over every way we can bring more production to the U.S., have better partners with more reliant streams of PPE or other medical supplies critical to the health and safety of the United States.
Gentleman's
Thank
time.
you, sir, for your appearance here today. Mr. Chairman, I yield. Thank you, good sir.
Thank you very much. Chair recognizes the gentleman from Louisiana for 5 minutes, Mr. Richmond.
Thank you, Mr. Chairman. Mr. Gaynor, let me ask, do you or FEMA has any role in procuring testing?
Yes, sir. The FEMA role has been is to provide. So just to step back, so the administration provided a testing blueprint to governors so they could build a testing initiative project regime based on their needs of their unique states. Our role has been to supply materials so they can conduct their tests.
Right.
So the two things that we have been doing since May is providing swabs and transport media to states. And my opening statement, we have shipped 42 million swabs and about 32 million.
But are you shipping test kits? No.
I am not, FEMA is not shipping test kits. I think a majority of test kits either come from the commercial sector. You can get them via the normal.
Well, let me just cut to the chase. In retrospect, would it have been a wise decision to take the test offered by the World Health Organization when this pandemic first started?
I would defer. So I have many great partners, and FEMA is.
Well, the short answer is we could use more tests right now.
We have done 50 million tests.
No, that's not my question. Can we use more tests right now?
I think we have enough testing platforms in the U.S. I think we have to maximize those testing platforms.
Wait, let's start over then. You're saying right now, as the FEMA administrator, the U.S. has enough tests right now.
Testing capacity is really the challenge of maximizing all that capacity.
Okay, let's move. I'm going to go to another subject. We want students back in school, correct?
Yes, sir.
And the president has declared a disaster. Through public assistance, which is run by FEMA, are you all going to include reimbursement for protective measures for school districts, such as masks for children?
Yes, sir. We have been looking at our authorities under the Stafford Act, what we can buy under emergency protective measures. I think one of the things that the administration wants to be thoughtful about is through many supplementals like the CARES Act, through the Stafford Act, how can you best maximize those funding resources? And I think when you look at the funding that's been provided by Congress to schools, it's pretty significant. And I think there's enough money out there that governors and mayors can use that money to do those things that you're talking about before they come to FEMA. It doesn't exactly fit into our authority.
But that's not true. I mean, look, I'm from New Orleans. I'm familiar with project worksheets. I'm familiar with public assistance. I'm familiar with all of those things. Protective measures always fall within the Stafford Act and FEMA when you're talking about public assistance. So I don't understand. It's fine to say, well, we think they have money other places. But normally, protective measures such as thermometers, shields, and all of those things would and should be. So we have an administration saying, go back to school. But we're not providing the school districts or others with the funding. Now, the HEROES Act that provides so much funding for public schools is wasting away in the Senate. Now, so we are not going to approve public assistance eligibility for masks. Is that what I'm hearing?
So what I'm saying is there's 17 different funding streams in supplementals that are specifically aimed at schools and public education.
Right. I'm not talking about 17. I'm talking about you. I'm talking about FEMA, and very specifically public assistance eligibility.
And again, I'll go back to, what is most effective? How can you maximize?
I'm just asking if you made a decision.
We have
I'm not asking for your train of thought.
Because there's other alternatives that are much better than Stafford Act funding.
So FEMA's not going to provide eligibility for masks. That's what I'm hearing. If that's the case, just say no and we can move on.
So I learned in this business, never say never.
Okay.
So we have examined our authorities. We're looking at how the situation develops. We're looking at other authorities that have other money put to this.
Let's move on to one last thing. Okay. What about a city's ability to pay hazard pay for things? I have a letter from a sanitation company whose guys on the back of the trucks, increased costs for the city in dumping. Would cities be able to apply for eligibility under public assistance to pay increased costs for dumping and sanitation and hazard pay for sanitation workers?
I would have to go back and look at the rules on that. I couldn't tell you whether it's eligible or ineligible.
Thank you.
But I'll follow up with your staff on that specific item.
Thank you, and now you're back.
Thank you. Chair recognizes the gentlelady from Arizona for 5 minutes. Ms. Lesko.
Thank you, Mr. Chair. First, I want to say I think it's mildly amusing that after you, in your opening statement, bashed the president, then at the end of the statement you said this is not about bashing the administration or Trump. I don't think any of us really believe that. But in any case, the next thing I want to say is that in my district, my staff checks on a weekly basis with all of our hospitals in Congressional District 8 in Arizona, and they have all told me they have enough PPE. Also, I want to address the things about the schools. We voted for relief for the schools. We gave billions of dollars to the schools to deal with coronavirus. In fact, $850 million went to Arizona alone, and that was to buy PPEs, masks, tablets, whatever they needed for coronavirus. Next, I want to thank you, Mr. Administrator, for having your regional FEMA people get on conference calls with me, because early on in Arizona, you know, everyone was worried about having enough masks, enough ventilators, everything, and your regional people would get on conference calls with me, the hospitals in my district, the Arizona Department of Emergency Management and the Arizona Department of Health Services, and they would directly answer questions to the hospitals. And so I thought it was very helpful, and please pass on to them that I think they did a good job. Also, I want to address about giving money to states and cities for this. We have given billions of dollars to states and cities to deal with coronavirus, so certainly what was mentioned by Mr. Richmond could be used for that. My next question, Mr. Gaynor, is about nursing homes. I have read that, I'm just going to read it. FEMA has shipped 28,562 deliveries of medical supplies to nursing homes to 53 states and territories. FEMA coordinated 2 shipments totaling a 14-day supply of personal protective equipment to all 15,400 Medicaid and Medicare certified nursing homes. And I also want to say that I joined Dr. Ben Carson, who personally came to Arizona to one of the nursing home facilities in my district, so I appreciate that the administration did that. But can you tell me, Mr. Gaynor, when you, nursing homes, usually that term is not used in the industry. Does that mean skilled nursing homes, or does that include assisted living homes, or what does that include?
The 15,400 are the 15,400 registered nursing homes with CMS, Medicare, Medicaid. So I'm not sure there may be different categories in that, and I would defer to Administrator Verma maybe to get the details on
Okay,
on what
thank
all that
you.
consists of.
And Mr. Administrator, the last one is, I know you've done a lot of work, FEMA has, with the Navajo Nation in Arizona and in other states. Can you expand on what FEMA has done or is doing with the Navajo Nation in Arizona?
Yes, ma'am, and thank you for recognizing my region. You have one of the finest regional administrators assigned to you out there, Bob Fenton, so I'd like to give him a shout out. But we have been working with the Navajo Nation nearly from the beginning. We continue to be out there. I think we have about 25 people on the ground from FEMA, to include many other partners from the Indian Health Service, CDC, ASPR. We've provided almost $85 million in funding together, about $5 million from FEMA and about $80 million from other sources. We provided ventilators, we provided surge capacity, we provided medical staff, both DOD and HHS, and logistics support to make sure that that community can respond to COVID-19. We continue to be out there. We'll stand strong with them until we put COVID-19 in the rearview mirror.
Well, and I want to say thank you to you and your staff, and I yield back.
Chair recognizes the gentleman from New Jersey for 5 minutes, Mr. Payne.
Thank you, Mr. Chairman and Ranking Member. It's an honor and privilege to be here this afternoon, this morning, actually. I would just like to start out with responding to the gentlelady from Arizona's comments. It is no one's pleasure to have to bash the administration, but I see that that's not necessary in Arizona. We have to be mindful that we are here as oversight obligation and as part of our duties. And, just like in the Obama administration, if there was need for criticism and bashing, we did it. And I don't think any administration should be above it. We just glad to hear that there are states that are getting support, great support from this administration. New Jersey, and based on the comments from the gentlelady from Texas and the gentleman from Louisiana, our states have been lacking. So I guess we're not in favor with the administration. So I guess it's who your friends are is how this is going to work during this pandemic. Mr. Administrator, with reference to going back to school, do you feel that that we have the capacity right now to keep students, teachers, bus drivers, administrators, anyone involved in the school day safe at this point?
Yes, sir. Again, no two states are equal, no two cities are equal, nor counties or tribes. And so there's lots of guidance out there that's been provided by CDC and others about what does a safe environment look like. I think governors have to assess their risk about going back into school. Some states, in New England, for example, are in pretty good shape. Other states in the Sun Belt see a rise in coronavirus cases and hospitalizations. They're going to have to assess that risk and make the best decision for their constituents. So again, I think what the administration has done is provide guidelines so we enable and empower governors and mayors to make really good decisions for their constituents.
And do you think, I hear the message you're sending out, but it's not necessarily the same message that comes out of the White House. What can we do to coordinate the message so people across the nation can be getting the same message and the same guidelines? You say one thing and then the White House comes out with totally the opposite. I mean, I know you don't have very much control of that, but don't you think that if there was a coherent, solid message from everyone across the board, that we would be in a better position?
Yes, sir. I think from my position on the White House Coronavirus Task Force, I meet most every day with the task force members, to include the Vice President, about a number of different things, to include messaging on schools, messaging on PPE. What are the facts and what are the narrative? What's the narrative? And so I think we're very thoughtful about not just creating a narrative and then finding the facts. We're trying to find the facts and create the narrative based on those facts. And what I just stated about going back to school is, what I assumed from being in the presence of the task force. So whether it's Dr. Fauci or Dr. Birx or others, I think the message that we're all sending is the same.
And one last question. With the rise in cases in Texas and other states, why would FEMA be closing testing sites as you see an increase in the need for those sites? It doesn't make sense to me that as a state is escalating, you're pulling out. You did it in New Jersey, at a kind of nearing a leveling off time, but we were still having an issue, and you left New Jersey, and but to see Texas and what they're going through in Houston and other communities, how do you justify closing sites?
Yes, sir. And so again, facts and narrative. So the facts are, when we first started testing in the United States back in March, we had 41 sites, 41 federally run sites. In some cases, we closed sites because they were not needed anymore. In some cases, we moved sites because where we were testing was not the place to be testing at, so we moved them. And in most cases, we transferred the responsibility of testing sites from the federal government to the state so they could run their own testing programs. Again, locally executed, state-managed, federally supported. Today, we have more than 750 test sites across the country. So it's not a single point in time. We've been flexible and adaptable and innovative as we move along. Testing will probably change over the next weeks and months to something different, something more appropriate based on what we're seeing with cases and hospitalizations. This is not a static problem. This is a dynamic problem, and I think testing is reflected in that.
Gentlemen, it's time.
Okay, well, thank you.
Thank you very much.
Thank you. I yield back.
Chair recognizes the gentleman from Pennsylvania, Mr. Joyce, for 5 minutes.
Thank you, Chairman Thompson and Ranking Member Rogers. Thank you for being here today, Administrator Gaynor, and for sharing your insights on emergency response to COVID-19. Truly a novel coronavirus introduced from China to the world and here then in America. This virus has challenged us on many different levels. Thank you and your team for ramping up what has been an incredible response. In face of the ongoing needs of personal protective equipment, which you outlined for us, such as masks, gowns, gloves, do you agree that bringing protection home to America, and by that I mean bringing the production of the masks, the gowns, and the gloves home, will allow us to better respond and replenish supplies?
Yes, sir, and I said it before, it's a national security issue. This is my own point of view, is that PPE, life-saving equipment, is just as important as building an aircraft carrier. We need to have that capacity here in the United States. We cannot rely on peer competitors to manage our destiny. We need to take hold of it, and we need to bring it back to America and build those things that are important to the nation.
Administrator Gaynor, in face of so many of these PPE supplies coming from China, would you again agree that bringing these production lines onshore to America would allow us not to be beholden to the Chinese Communist Party?
Yes, sir, I think my previous statement stands. I mean, it's in our best interest.
Do you feel that the Defense Production Act has allowed FEMA to better perform your duties?
Yes, sir. We've used the DPA 14 times. We continue to use it for a variety of challenges that we see. Again, it's just not as easy as flipping the switch and moving from making toasters one day to making vents the next day. There's thoughtful consideration about using DPA. One of our initial beliefs was we wanted to do no harm to the system. Make sure we understood if we did this, what's going to be the result of that, unforeseen consequences. So we use it deliberately, we use it precisely to make sure that we get what we need at the right amount of time. And I think the production of ventilators is an excellent example of how the administration used DPA to save lives and minimize suffering.
You addressed national security and safety. Do you feel that bringing safely home the production of medicines, both prescription and over-the-counter medicines, vaccine production, and therapeutics, personal protection equipment that we've discussed, are all necessary components for an effective national security and safety of all of our citizens.
Yes, sir, and I want to thank Congress for providing $1 billion to Department of Defense and the Defense Logistics Agency to do all those things. You know, how do we become more resilient by bringing some of those things back home?
Thank you, Administrator Gaynor, for being here today, to addressing our questions, and for working hard as we fight this novel coronavirus. Again, thank you, and I yield the remainder of my time.
Thank you. Chair recognizes the gentlelady from New York for 5 minutes, Ms. Rice.
Thank you, Mr. Chairman. Mr. Gaynor, when we held part one of this hearing a few weeks ago, Governor Pritzker of Illinois noted that Project Airbridge was, and I'm quoting him, an utter and complete failure in his state of Illinois. And I think that this was in part because Project Airbridge and the medical supply companies that you at FEMA have partnered with on this project are moving supplies from overseas to existing customers instead of distributing those supplies by need. It's my understanding that Project Airbridge has now conducted 249 flights. What percentage of the national need for PPE was supplied by the Airbridge project?
Yes, ma'am, and thank you for giving me the opportunity to once again clarify you know, I think the governor, the governor of Illinois is misinformed about the purpose of Airbridge, and if he's calling it a failure, I'll just say that we shipped to his state, Illinois, a million face shields, 841 million gloves, 16 million gowns, nearly 12 million N95 masks, and nearly 45 million masks. So if it was a failure, then I guess that's a failure. The purpose of
Mr.
the
Gaynor,
Airbridge.
Mr. Gaynor, if I can just interrupt you there for a second. I'm asking specifically about Airbridge. I'm not talking about, I mean, I don't know if you saw, there was a recent report back in May from the Washington Post that reported overall that Project Airbridge flights had distributed 768,000 N95 masks, which is far fewer than the 85 million N95 masks procured through conventional federal relief efforts. So I'm asking you to confine your, the numbers that you use specifically to the Airbridge project, not other conventional federal relief efforts.
Yes, ma'am. Again, you brought up Governor Pritzker. I just want to make sure that we set the record clear about what's fact and what's uninformed narrative. Airbridge, again, I said in my opening statement, was our effort to accelerate PPE from around the globe to the U.S. to prevent suffering and to save lives. Very simple. We partnered with the 6 biggest commercial medical grade distributors in the country, companies like McKesson and Cardinal and others, to partner with them to bring this PPE to the United States. Again, typically it takes 37 days to put PPE on a container ship and get from Shanghai to LA, and we did this in 1 day with a Airbridge flight.
So, Mr. Gaynor, let me just stop you there because I have very limited time. I understand that it sped up the time it took for stuff to get here. If it's not going where it needs to go, for instance, you know, nursing homes don't have previous relationships necessarily with, you know, medical supply companies. And it's my understanding that once the PPE got here, it was basically left up to the medical distributors to decide where it was going to go. There was a requirement that it go, in order to justify the subsidized cost of the flight, that it had to go to states with the most need, but that's not how it happened because they prioritized people with whom they had prior relationships. So you can
yes, ma'am.
Again, you can tell the success of how long it took to get stuff here, but if it's not going where it needed to go, and we know it didn't, that doesn't help.
It's not, and again, I want to be respectful, but it's not how it worked. So our agreement, our written legal agreement with the big 6 manufacturers and distributors was 50% of all the PPE that we moved via Airbridge, to include what commercial distributors brought in on their own. 50% of all that was directed to hotspots. Those hotspots were prioritized by us, FEMA, HHS, Dr. Burks with her daily data to make sure that we're aiming, again, life-saving PPE to the places that need it the most. The commercial companies could not pick and choose where they sent it. A certain percentage, yes, they could use a certain percentage to service their customers, but for the majority of that PPE, they directed it because we prioritized it to where it was needed the most. And we did that every 96 hours to make sure that we understood where are those places that need it the most and directed those distributors to do it. One of the great things about Airbridge and our supply chain control tower, we can see down to exactly into all the 6 commercial distributors what's on the shelf, what was ordered, what zip code it went to, and what hospital it went to. We supplied all that data every week. We still do it every week to governors to show here's all the PPE, whether it's donated, whether it's Airbridge, or whether it's government. It all goes to these exact places. Governors have complete transparency on the use and distribution of PPE, whether it's Airbridge or whether it's through the commercial sector.
Thank you, Mr. Gaynor. My time is up, but I just think it's important to note, because this was raised before, that I don't know if you answered this or it was a question put to you about how President Trump inherited the stockpile. The fact is that he sat on that stockpile, should have been aware that it was not sufficient for 3 years. So he can't blame anyone other than his own administration for not heeding the warnings that a pandemic was coming and not making sure that we had the supplies that we needed of PPE well before March of this year, which is why Project Airbridge even had to be conceived. So thank you for your testimony here today. And Mr. Chairman, I yield back.
Gentlelady yields back. Chair recognizes the gentleman from North Carolina, Mr. Bishop, for 5 minutes.
Thank you, Mr. Chairman. Mr. Gaynor, you've been in emergency management for a long time. Is the morale of the American people important to successfully responding to the pandemic, in your judgment?
Is the morale of the American public important?
Yeah.
Oh, I believe so. Yes, sir.
Yeah. Does it do appeals to panic and recriminations advance your mission or make it more difficult?
Panic does not help in any disaster, sir, whether it's hurricane or whether it's COVID-19 response.
If appeals to panic and recriminations are fed by misinformation and distortions, that's doubly so, isn't it?
It makes the job a little bit harder, sir, because not only are you trying to deliver solutions to those most in need, you're trying to fight a narrative that sometimes is untrue.
Do simplistic criticisms that belie the complexity of the situation you're dealing with, do those help you or retard the effort you're making?
I guess I would have to hear how simple the interpretation of what we're talking about is, but you know, I think facts, solid facts based on data, and that's what we've been doing at FEMA, data-driven decisions based on everything that we know. And I'm not saying we know everything, but within our limits of knowing, we make data-driven decisions, and it's our goal to make sure that data, facts drive the truth and the narrative.
You testified in response to Mr. Richmond's question that we have adequate testing in the United States, and I think I'm not sure I'm recapitulating your statement perfectly, but that we need to maximize the utilization of it. I think, something like that. Would you, if you recall what I'm talking about, would you address that and elaborate, explain that?
So early on when the testing, even before the testing blueprint was published, because I was a member of the White House Coronavirus Task Force, we wanted to make sure that we knew of where all the testing platforms are in the United States. Every single one, from doctor's offices to universities to colleges to veterinarians, who had a platform that can do testing. And through a lot of hard work by a lot of talented people, we identified all of the testing platforms around the country and gave those to governors. And our goal was to enable governors to devise a testing program that fit their state and their needs. Not every state is equal. Cases aren't equal. Hospitalizations aren't equal. ICU use and ventilators are not equal. So each state had its own unique demand signal on testing. Now it's changed. You know, we focused on New England and New York and New Jersey a couple months ago, and now we're looking at the Sun Belt. I'm not gonna say that testing is not stressed in the Sun Belt, because it is. But we provide resources to states to make sure they have enough to do that. And I think it was announced a couple days ago that the administration is purchasing testing machines for every single registered nursing home in the country, 15,400 testing machines to make sure we take care of our most vulnerable. So again, this is a dynamic situation. We adapt as we go. We learn as we go. If we had a shortfall or mistake, we take that on board and we correct it. Emergency management and crisis and this historic COVID-19 response, no one has done this before. And we learn as we go. I have 20,000 dedicated employees that work hard every day. There's 40 other agencies that are in support of FEMA and HHS as we battle COVID. Tens of thousands of dedicated employees out there making sure we do the best thing. And if we fall a little short, we'll pick up, we'll adjust, and we'll make it better the next iteration. And that's how it works. Emergency management, respond to crisis, is not a perfect game. There will be mistakes made, but we learn from them, and we adapt and overcome, and we will be successful. I have no doubt about it.
In testimony referred to earlier, Governor Pritzker of Illinois insisted that if the administration had just used the Defense Production Act and just taken everything, it would have been magic. We could have resolved all problems with respect to the PPE. Is that true or false?
I believe it's false, sir. And let me give you an example. And I talked about doing no harm with the DPA. If you remember back, there was a large demand, still a large demand today, but a truly large demand for N95 masks. So when you ask the producers who make those to make more, they willingly did it. So whether they're making them in the U.S. or they're making them in China or somewhere else, they did it. But the material for N95 masks is the same material for gowns. And so the result of making more masks is now you don't have enough material for gowns. And so you have to be thoughtful about how you run those levers on industry. It's just not simple. We're going to turn a light switch, and today it's TOSAs, and tomorrow it's N95 masks. It doesn't work that way. We want to be thoughtful about it, and we want to make sure we do no harm to a system that, in some cases, when it's medical-grade PPE, is under stress. So we use the DPA very deliberately. We use it very precisely, and we have great success stories like ventilators to show for it.
Thank you, Mr. Chairman. My time has expired.
Thank you very much. Mr. Gaynor, your testimony to this committee is that we use the Defense Production Act in a timely manner.
Well, I'm not sure I use the word timely. I'm saying we use the Defense Production Act when we understood when and how to use it. And so, again, this is what I said before, do no harm. And so just to radically use it from day one, you don't know what the consequences are downstream.
Well,
so
conversations
with industry, conversations with our private partners to understand, hey, if you do this, this other thing will suffer. Those conversations were going on with the administration, with the task force, with FEMA, with HHS, with DLA, DOD, to understand, hey, if you do that, you may get a negative result on this. So when we understood that, hey, we're going to use DPA for the best result, then we executed it.
So your testimony is that when the Defense Production Act was used, it was used in a timely manner.
Those are your words, Mr. Chairman. I'm saying,
no,
I just explained how we used it.
I'm asking you that in the execution of the Defense Production Act, was it used in a timely manner?
From my point of view, we used it when we needed to use it, when we understood the entire environment about the pros and cons of executing the DPA, whether it was Title I, Title III, Title VII. We want to understand all those things.
When you did all that, yes or no?
My answer stands as answered, sir.
Yeah, well, okay. Chair recognizes the gentleman from California, Mr. Correa, for 5 minutes.
Thank you, Chairman Thompson, for holding this most important hearing. Our nation is failing in our response to COVID-19. Let me, if I can, talk a little bit about Main Street in my district, where today, almost on an everyday basis, I begin to hear the names of individuals that I know that are dying. I live in a hot spot, Santa Ana, Anaheim, California, home to the happiest place on earth, Disneyland, that has been closed for a number of months now. a lot of unemployment, a lot of people suffering, a lot of people dying. Mr. Gaynor, thank you for being here today. You mentioned that you're part of the COVID task force. Is that correct, sir?
Yes, sir.
Would you say that we're still learning about COVID-19? We just don't have enough data? We're learning right now.
Well,
yes,
I mean,
no?
I think one of the members mentioned it's a novel
Yes.
disease, right?
So we're
Brand
still
new,
learning.
Didn't exist on the planet.
But a little bit that we know of COVID-19, I mean, can we agree on some basic things like social distancing works, face mask work?
Yes, sir.
And I'm hoping we have a national message that actually tells people that these basic things, a little bit that we know, that face masks work. Because the confusion in my district, okay, folks dying, the horror stories I hear of people out there with no face mask at social events is terrible. You mentioned do no harm. You mentioned watch out for unforeseen consequences. And you also mentioned that we're still importing almost all of our PPE. You're on the planning task force for COVID-19. Can you tell me, when can we expect to be functionally supplied in this country? When can we manufacture for our own nation's defense PPE, enough PPE? My wife's a doc. She came home 2 weeks ago and said, guess what happened last night? I said, what happened? Said, somebody stole my protective equipment. She delivers babies. She's around positive COVID-19 patients on a daily basis. When can we, sir, expect to have America manufacture PPE for our population? When can we be there, sir?
Yeah, yes, sir. So let me just go back to the mask things because I just want to help you.
It's a yes or no. Do they help? Yes or no? It's
I just wanna
basic answer the question.
You made a previous statement. I would just like to
I only
hopefully
have 2 minutes
help
left.
the
and I'm
dialogue
not
about
through.
wearing a mask. So wearing a mask, it really, the message I think we all want is the mask really doesn't protect me, right? Me wearing the mask protects you.
Does wearing a mask help in a COVID environment?
Yes, sir. Yes, sir.
Yes.
That's
all I want.
Well, wearing a
social distancing works.
Social
yes.
distancing, hygiene, staying
So
out of bars, crowded places.
I'm going
all
to
those
reclaim
things
my
work.
time, Mr. Chairman. Sir, I'm not trying to be argumentative. As a representative of my constituency, I want to know, you're on the Planning Commission for COVID-19. When can we expect to have enough manufacturing of COVID-19 protection gear in this country?
I can't give you a date, sir. Again, it's not a light switch.
Speculate. I mean,
it's a
we talk
rheostat.
about
So
do
we're
no harm,
working.
unforeseen consequence.
I'm just
Go
trying
ahead,
to answer
sir. I'm
your
gonna
question,
let you
sir. I don't
answer.
want to get
Go
an
ahead.
argument. But we have been working on increasing industrial production of PPE for months now. Again, it's happening.
If I may reclaim my time, thank you very much. You know, as I look at post-COVID-19, this is like post-911. We're never going to go back to being the way we were before. We may have COVID-20 ahead of us. And I'm just hoping COVID-19, again, teaches us that lesson that we forgot that we should have learned from Ebola and Zika. We're asleep at the wheel. And this is not blaming anybody, but I'm trying to figure out, you're in that hierarchy at the top levels of planning for the next pandemic. Bad guys around the world have finally figured out a new way to hit us. And heaven forbid, heaven help us if somebody drops a dirty biological, a dirty viral bomb on our country. We're not ready, and that's what you're telling me right now, Mr. Gaynor. You don't know when we'll have that
I'm not
supply
telling you
up and
that,
running.
Congressman. I'm not telling you we're
gonna
not ready.
reclaim my time.
Your question was
and
about
if
PPE.
China, again, decides to lock down and not export PPE, where are we going to be? Please.
So first of all, sir, I said in response to a member that FEMA has never been more than ready. And I've said repeatedly, this is just not about throwing a bunch of money at PPE and having it all tomorrow where we want it, when we want it on the U.S. It takes time.
And in the last 2 seconds, I'm going to reclaim my time, sir.
I want to answer your question, but I just want an opportunity to
I'm out
actually
of time,
speak.
and I look forward to getting your answer to your question in a written form. And Mr. Chairman, if I could have 15 seconds, I just want to say this. I do believe that COVID-19 has brought us to a new environment in this society. We have to plan with these kinds of attacks, either by Mother Nature or by bad guys in the future. And you're in FEMA, and I hope and I pray to God that you're moving ahead to plan to protect this great country's population.
COVID-19 is not an attack, it's a disease. It's a new disease that we've never seen
And
on
that's
the
why I
globe.
said it's Mother Nature.
And it's much different from Zika and Ebola. So again, we're comparing apples and oranges to this. So again, I want to tell you that there's tens of thousands of dedicated
Thank you.
Americans
I look
out
forward to
there
hearing your
working on this problem
statement
today.
in writing.
And they've been working on the problem for months. And we will overcome it. I can't give you a date, but I can guarantee we'll have enough PPE made in America for the next crisis.
Mr. Chairman, when do you guarantee to have PPE ready?
I just said I couldn't give you a date, but
Okay.
we
Thank
will
you very
we
much.
will be successful. I have no doubt
Gentleman's time
about the
has
power
expired.
of the American public and American industry and American resolve. No doubt whatsoever.
Chair recognizes the gentlelady from New Mexico, Ms. Tara Small, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ranking Member. And thank you, Mr. Administrator Gaynor, for being here today and for all of your work to try to stop the spread of COVID-19. In preparation for today's hearing, we've heard perspectives from the GAO, from a former FEMA administrator, and from state officials. And something I repeatedly heard was that because the administration wasn't able to provide a national strategy to procure PPE and medical supplies, states were left on their own to buy these supplies. And that pitted states against each other, creating unpredictable availability and soaring prices. And I really appreciate you recognizing that in your opening statement, the same challenge when it comes to states having to compete to purchase. Here's the problem for my home state in New Mexico. These bidding wars that states were forced to partake in put smaller and rural states with less purchasing power, like New Mexico, at a disadvantage. So you testified earlier that your role is to help state and local governments if they have a deficit, and I deeply appreciate that. You also testified that you support a national strategy for increasing domestic production of PPE and medical equipment, and I deeply appreciate that. Do you also believe that the administration should implement a national procurement strategy to address this national emergency and make it easier for states to get PPE and medical supplies?
Yes, ma'am. And so, again, just to go back, we were in global competition for PPE. 150 more countries, every governor, every mayor, every tribal chief, looking for the same exact thing, global competition. And where it was made in China, where manufacturing was ramped down because they were dealing with COVID-19 themselves. And so we have a ways to go to make sure that we have a reliant industrial base that can make PPE in America, not just for while we respond to COVID. And this is the trick. We need to do that, and we need to support those industries for the long haul. Right? It's just not for a couple years. We need to support them so they can stay in business, they can be competitive, and we can get PPE when we want. So we have to do that.
Thank you.
We have to.
Administrator, I know I've got other questions.
Okay.
I did want to let you go back, but wanted to also make sure I get to ask a few more questions. But so I appreciate you recognizing the national strategy for procurement as well as getting more producers domestically. And I am focused on what we do moving forward. I really appreciate your comment that emergency management isn't about perfection, it's about getting better. And so moving forward, having that national procurement strategy as we see increasing cases, again, will be very helpful to rural communities like the ones I represent. I also want to just shift to non-federal cost share for tribes. Really appreciate you recognizing the work that FEMA has done and you spearheading the work that FEMA has done to support tribes. My state of New Mexico is home to several tribes and pueblos, and they've been disproportionately affected by COVID-19. In fact, as of May in New Mexico, American Indians composed 57% of COVID-19 cases, even though American Indians only account for 9% of the state's population. And New Mexico is not alone. In Wyoming, American Indians account for 30% of the cases compared to just 2% of the state's population. And in Arizona, the numbers are 11% compared to just 4% of the population. Administrator Gaynor, thank you so much for your actions on to serve tribal governments. Many tribal governments have requested a waiver of FEMA's 25% non-federal cost share. Are you aware of those requests? I certainly understand that. And given the disproportionate impact on Native American and sovereign governments, have you recommended an increase in the current reimbursement level for tribal pandemic response efforts?
We have not, although we've had numerous conversations with the administration and OMB. And one of the things that we're trying to be considerate about is all the other funding that's out there. And I mentioned it before, I forget what the topic was, but schools, there's lots of funding out there that maybe in this case, a tribe could use that has more leverage than Stafford Act.
I've got to reclaim, just because for Native American sovereign governments, there was an incredible delay in getting the money that was out there from the CARES Act. There was an incredible delay in getting the money that was out there from previous funding streams from the compromise and the earlier legislation. And so now they're being pushed to spend that money very quickly before the end of this year. So there isn't money out there elsewhere. So I hope that you'll reconsider reducing that share.
So it's under consideration. The president has the final authority to approve cost share, so whether it's something less than 75-25, but we're in active conversations with both the administration and OMB about how we actually execute that. A part of the problem is we're still in response. And when does if you're familiar with how a disaster works, there's the beginning of the incident and there's the end of the incident. So all those considerations have to be taken into consideration. So there's not an end date to this, and we just don't want. We want to be thoughtful and meaningful about how we get to an answer.
I yield my time.
Thank you very much. Chair recognizes the gentleman from New York, Mr. Rose.
Thank you, Mr. Chairman. Mr. Gaynor, I want to talk to you about a comment that you made earlier where you noted that lab capacity is at sufficient levels. Am I correctly phrasing what you said?
So I think nationally there's capacity. I think based on where a certain jurisdiction is today, hospitalization.
Of course. So across the nation,
be stressed.
Right. Of course, across the nation, if you take into account laboratory equipment, availability of reagents, as a nation, we have enough infrastructure to test. It's just a matter of where the testing is happening. Correct?
Generally, yes, sir. And again, Dr. Jawar is the testing expert, and I don't want to get into his lane too much.
Of course.
Generally, that's how I am.
Based off that proposition, then, across the nation, what does our capacity allow for us to test?
I would have to defer on the
But
the total today. I mean, we've tested 50 million
but that's
so
not,
far, and we're testing about 800,000 a day.
No, I agree. I think that we need more. I would argue that we need much more on a daily basis. So the numbers are great, especially when you say 50 million. It looks, wow, oh my God. That's not enough. That's not enough. We need to test 20 million people a day in this country. So when you come before us and you say that the capacity is enough, but then when I ask you what the capacity allows for us to test, and you say, I don't know, it's difficult to continue the conversation. Because I want to then talk to you about, okay, if the capacity is enough, how do we divert tests from one part of the country to another? I want to talk to you about swabs and the fact that we don't have enough swabs and they're glorified Q-tips, and this is the greatest country in the history of the world, and why don't we have enough swabs? But my hope is that you can take our questions seriously. So if you tell us that we have enough infrastructure in this country, i.e. enough laboratory equipment and enough reagents, I want to know how much would that let us test?
And again, I am not in charge of testing. I would defer the details of specific numbers of testing platforms and all the Dr. Jawar. What I'm saying generally, there is testing capacity. It is stressed in locations that have increased cases, increased hospitalizations. There's no doubt about it. We have been shipping. There's not a shortage of swabs. There's not a shortage of media.
So then what's the problem? If what you're saying is that we only have particular hot spots in this country where there's not enough testing, whereas in other places there's more than enough swabs, more than enough infrastructure, what's the problem? What aren't we doing well enough as a country?
Well, again, like I said in the beginning, we learn as we go, and where we started out with 41 testing sites, now we have 750. As the disease moves from an epicenter like New York and New Jersey to now where it's seated more differently across the Sun Belt in virtually every county. It's different, and so we'll adapt as we go. One of the ways we're adapting is HHS and Dr. Jawar. Another initiative is to purchase rapid testing for 15,400 certified.
And those are good things.
We learn as we go and we adapt as we go.
But those are good things. But you can see from our perspective how it's difficult to get a specific answer. What should our goal be as a country? How many tests should we be doing
again,
every day?
I'm not a medical doctor. I would defer to Dr. Jawar on all those medical kinds of things. Our goal is to save lives and minimize suffering. That's our goal.
So you're telling me that you are not, at your disposal, you don't have a national target for testing?
What I'm saying is I'm not in charge of national testing. Dr. Jawar from HHS is, and hopefully you can get him to explain in detail about the testing strategy. I know what our role from FEMA is about supplying material like swabs and media to governors to run their very unique testing.
And you're saying that we have enough swabs right now?
Yes, sir. Yes, sir. We shipped 42 million swabs in less than 3 months, and we shipped 32 million media in 3 months, and we can do more than that.
How many more can you do?
It depends on the demand. How many more can we do? We can do millions more.
Could you do 100 million? I mean, do you have a number for what is our capacity for swab production right now?
I would have to defer to HHS, who runs the testing program.
Okay, so for all testing issues, go to HHS. Is that the point that you're making here?
Other than what FEMA's role is today.
And what is FEMA's role in terms of testing?
Shipping swabs and media to states so states and governors can run their testing program.
So I just asked you, how many swabs can we ship in this country?
I can tell you what we have shipped.
But how many could we? That's my, it's just a basic number.
Again, I mean, I would have to go to the supply chain.
And by the way, it's an acceptable response for you to say you'll get back to us. I'm okay with that. What I'm not okay with is the hot potato here. I'm trying to ask you.
There's no hot potato. It's just a matter of that. That's not my my role at FEMA is testing. It's HHS's role. There's no hot potato here. I'm just telling you the way it is.
But I understand my time is up. But just to review the conversation, you said HHS is testing.
Mr. Chairman, point of order.
The question is answered.
Hold on a minute.
Mr. Chairman, this is the third member of the Democratic majority that has exceeded by some distance their time in questioning and persist in asking questions after their time has expired, not only when the witness finished their answer.
Let me be clear. I've been very, very tolerant with every person who asks questions, and I plan to continue. Gentleman from
I'll bear that
New York
in mind.
may continue.
Mr. Bishop, thank you for your diligence.
I have been diligent in answering my questions when the time
to be better.
Let me just for the record indicate that, Mr. Rose, we invited HHS to be a part of this committee hearing so we wouldn't have the absence of information for testimony. Chair recognizes the gentleman from New York, Mr. Katko.
Thank you very much, Mr. Chairman. I can take my mask off. I want to just start by saying thank you. This has been a once-in-a-century pandemic that's hit this country, and there has been mistakes made. There's no question. And before we start pointing fingers, I just want to say thank you, because we've done so much to try and get it right. It's not easy, and there are mistakes. There's no question about it. And I can tell you some bright spots. In my district, a plastics manufacturer shut down his factory, one of his 6 locations, and is converting it into a test manufacturing facility. By the end of this month, he will start producing 1 million tests a month. And that's happening all over the country. We're responding to something that, and I credit what you say, it is a moving target. Things are changing quickly. We thought up until recently that once you tested positive for COVID, that if you have the antibodies, you're okay. Now we're finding out the antibodies might not be lasting. That's another wrinkle we didn't test, and we could not foresee. So There have been mistakes, and clearly FEMA's made some mistakes. Clearly everybody has. Clearly we have. But the bottom line is I want to say thank you to all the men and women who are on the front lines, like my son, who is running a testing center for the National Guard, who put his life on the line every day and his kids' life on the line that he's commanding. And the FEMA people are out there on the front lines trying to do the right thing. So thank you, and thank you to everybody in the United States, everybody who has done their job and is trying to fight this awful pandemic. I know nurses who have given up their jobs and careers and walked into nursing homes that have 100 to 150 positive patients and volunteered to go in there. There's so many great American stories out there, and I'd like to just pause for a second and emphasize some of those great stories, because that's what makes America great. Can we be better? There's no question about it. And so let's keep it balanced here. Now, I just want to take a step back, and I'm sorry I got here late. I don't know if this question's been answered, but could you give me the status of what's going on with the air bridge? Is it still going on? Is there still flights coming in, and what's going on with that?
Yes, sir. And just to go back, and thank you for saying that there are successes, but I like to say that many more successes than there are mistakes or shortfalls, and I want to be on the record.
Yeah, and understand it's our job to commit oversight, and so I commend my colleague from New York for probing, but the bottom line is, let's keep the balance here. Let's keep eye on a big ball. We've done a tremendous job under unbelievable circumstances. No one could have foreseen what's happened here. So
yes,
to all the frontline workers, just thank you.
Thank you, sir. Airbridge concluded with 249 flights around the 1st of July, bringing back critical supplies from China and other places to the United States. And this was again, Airbridge is a way to accelerate those critical resources to frontline workers so we can minimize lives and protect lives and minimize suffering. So Airbridge has been sunsetted, and this, that time that we ran Airbridge has allowed manufacturing overseas to catch up, to get more greater quantities on shipping container ships, and so that typical mode of transportation pre-COVID on container ships is now more intact and more frequent, and has allowed commercial producers to distribute more PPE across the country.
Great. And going forward, I just want to kind of ask you, what do you think we should be concentrating on to assist you in doing your job? What are some of the things that haven't been done yet that maybe we can consider in the next package?
Well, I want to thank Congress specifically for funding the Disaster Relief Fund. This has allowed FEMA to fund PPE and staffing, alternate care sites, all those kind of things that governors and mayors need. So I thank you for fully funding that. I think the challenge for FEMA right now, especially with the outbreak in the Sun Belt, is making sure we have enough adequate staffing. Again, I took a tour of the Gulf Coast last week. The demand for PPE, we didn't hear that. The demand for ventilators, we didn't hear that. The demand for alternate care sites or beds, we haven't heard that yet. The demand is really for medical professionals in hospitals to kind of backfill those kinds of needs from, 50% of all the cases now are Florida, Texas, California, and Arizona. And so that's kind of our focus. And so getting volunteers from other parts of the country to go down and help would be helpful to us to increase that bandwidth. Medical doctors, nurses, respiratory therapists, they are a high-demand, low-density asset, and you have to be really careful about where you get them from. In some cases, you would say, well, we'll activate the National Guard or we'll activate the reserves, but those doctors that are in the reserves are doctors in hospitals today. Mm-hmm. So there's a delicate balance that we're trying to maintain, but right now, our concern is making sure we have enough medical professionals in those 4 states to deal with rising cases and rising hospitals.
You mentioned the disaster relief fund. Last I heard, and it was a while ago, forgive me, I don't know the numbers now, I know it was pretty well funded. I was at least $75 billion in it. Where are we at now with the fund?
Yes, sir. So Congress appropriated about $45 billion extra, which brought it, and this is in the beginning of our response, so about $80 billion. We've spent about $8 billion obligated so far. But there's more to come. And again, expenditures lag because there's a.
But also that fund has to be used in case there's a hurricane or whatever as well. So
correct. So it's for
yeah.
COVID response, it's for natural disaster response, so whether it's a hurricane or a tornado or flooding, and it funds recovery across the country. So as far back as Katrina, that fund is used for that.
All right. Thank you for indulging me, Mr. Chairman. I yield back.
Thank you very much. Let the record reflect that you were 1 minute, 30 seconds over.
I was 1 minute and 29 seconds. Come on now.
And I did not, and I did not call time on you.
Thank you very much.
We try to make this thing work. Chair recognizes the gentlelady from Illinois for 5 minutes, Ms. Underwood.
Thank you, Mr. Chairman. Mr. Gaynor, thanks for testifying today on the administration's response to this pandemic. As a former senior advisor at HHS, I know that a successful response to a global public health crisis of this scale requires a whole of government response with clearly defined leadership. I'd like to get a better understanding of how this administration approaches that. Yes or no, is it your understanding that FEMA, as of today, is charged with leading the operational coordination for the federal interagency response to this pandemic?
Yes, ma'am, we're still leading the coordination for the response.
So with FEMA leading the federal response, do you report directly to the president on coronavirus matters?
Did you say, can you just say it again? It's very
I said
faint.
with FEMA leading the response, do you report directly to the president for coronavirus matters?
Yes, ma'am. Both the president and the coronavirus task force with the vice president. Absolutely.
Okay. So according to your testimony, FEMA has been, quote, coordinating the whole of government response, end quote, to the pandemic since March 19th. Let me be clear. FEMA employees have worked incredibly hard in the 4 months since. But the truth is that FEMA was not designed for this type of crisis. A pandemic that impacts every state simultaneously and lasts a year or longer is very different from a localized disaster like a hurricane. So in the 4 months that you've led the response, have you asked the president for additional resources
The Office of Unified Communications serves as the communications gateway and lifeline for citizens that are in the District of Columbia. We handle all 911 and 311 calls and are...
We still lead the coronavirus task force. I have many great partners, to include HHS. It is correct that some of the functions that have transferred back to HHS because it's more appropriate, because it's medical. Early on, again, we adapted, and as we become more confident, we have better systems, we have better data, we understand the problem more. Some of those functions have shifted back to HHS, but let me be clear. FEMA is still in the operational lead for operational coordination. We're glued to the hip with my HHS brothers and sisters, and we still meet every day on making sure we can deliver the resources to the nation, especially those that are most at risk and most under stress of COVID-19 cases and hospitalizations.
Well, Mr. Chairman, I just have to tell you, Mr. Gaynor's testimony seems to directly contradict his written testimony that he'd submitted. At the end of page 8, beginning of page 9, he talks about FEMA returning to the steady state normal operations, and now he's saying that they remain in charge of the operational response. I have tried in my 5 minutes, sir, to get an answer, a direct answer to this very straightforward question, and like Mr. Rose, seem to be getting a little bit of a looped circular response here. We're seeing almost 60,000 cases a day. Healthcare workers don't have the PPE that they need, and no part of our federal government can be in normal operations at this time. We need an aggressive, coordinated federal response to contain this pandemic and reopen safely, and it's been lacking from this administration. I yield back.
Yes, ma'am. Just to kind of follow up on some of your comments. This is a ever-changing situation.
Mr. Gaynor, you don't have to answer. She was just making a comment. She wasn't asking for a question. Chair recognizes the gentleman from Texas, Mr. Crenshaw, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Administrator Gaynor, for being here and being so patient in the face of what are often disingenuous criticisms and accusations. A lot of good questions, I think a lot of reasonable questions, but also a lot of the opposite. And I would like to think that this hearing is about learning lessons and constructive criticism, and it should be. We could ask good faith questions about how to improve our response, taking into account that imperfect results are inevitable in the face of a once-in-a-lifetime pandemic. It shouldn't be about levying unfalsifiable claims. See, the critics can never be wrong, no matter how much PPE was delivered, no matter how many air bridge flights were flown. You can always claim it wasn't enough, and perhaps it wasn't. But if we're going to do constructive criticism, the critics should point to pivotal decisions where everybody said, do this, and instead you did something else. I've never heard that criticism. Interesting that we haven't. When it comes to these problems of say, nurses or doctors not having PPE in their hospital, those are certainly concerning claims. I believe we're lucky in the Houston area. We rarely hear that, if ever. Do they have a direct line to FEMA? Is that how this works? Again, let's talk about what is the proper lesson learned here. Are they ordering directly from FEMA? And if they don't get it, do they call your hotline and request their PPE? Or is that not how it works?
Yes, sir. Great question. So I'm going to start with the premise that to be successful in an emergency, it has to be locally executed, state managed, and federally supported. I spent 8 years as a local emergency manager, and I spent almost 4 years as a state director. And now I lead the Federal Emergency Management Agency in this response. There is a system that we use at FEMA for natural disasters, and it's the same system that we decided to use from the beginning of this, a system that people were familiar with from the localist level, mayors and governors, tribal chiefs. If you needed something from FEMA, we had a system designed to address that. I have 10 regions across the country, as far west as American Samoa and as far east as the U.S. Virgin Islands, 9,300 miles. 10 very talented regional administrators that are the tip of the spear for FEMA, making sure we address every need that we get from states.
Okay,
so it's
trying to quicken the
it's
answer.
local,
It goes
state,
through regional.
federal.
It goes through regional
If there's a need from a hospital for PPE, they can easily contact their local government, and it will get through the pipeline.
Right.
Yes, sir. I mean, that's typically how it works.
Yeah, understood. And when it comes to nursing homes, there was a priority of delivering PPE to nursing homes, delivering more than 29,000 packages of supplies in 53 states and territories. You saw the vulnerabilities in nursing homes. Was there, in hindsight, is there anything more FEMA could have done to stop governors in, say, New York, Michigan, Colorado from putting infected patients back into confined nursing home facilities? We know in hindsight that was a terrible idea.
Yes, sir. So I'm not a medical doctor, so I'll leave the medical considerations about what you do with patients to those that have a MD at the end of their name. You know, what we do at FEMA.
I don't know what's so funny about that.
And through the...
Not funny. People died because of that decision.
Sure. But what we do at FEMA is, again, no matter if it's COVID-19 or it's a hurricane, is we support elected leaders. So whether you're a governor or a mayor and you have a disaster, we fully enable you to execute what you need to do in your specific state or locality. Again, federally supported, not federally managed, and not federally executed. The system only works when all those things work together, and of course when citizens are prepared also. So we enable governors through a variety of different systems to include funding, materials, technical assistance to address those needs by their constituents.
And talk to me about Project Airbridge. Is this a success? Is it a failure? What could be done better with it?
Yes, sir. So it was an absolute success. And again, it was about speed. It was about, at the direction of the president, you know, go find every piece of PPE around the globe and bring it to the United States. Pretty simple mission order, right? Go do that. And Airbridge allowed us to do it. It's one of the things we typically do at FEMA. We have a pretty vast logistics arm. We've used planes and boats before to transport material to disaster sites. And this allowed time so we could, again, build that industrial base, get more produced onshore, find more confident foreign producers that we could rely on, and again, get that specific PPE to where it's needed the most. Those frontline workers, nurses, doctors, caregivers, CNAs in nursing homes where it mattered the most. So it was about saving lives. Ultimately, it was about saving lives and minimizing suffering. That was ultimately what it was all about.
Thank you. Yield back.
Thank you very much. Chair recognizes the gentlelady from Michigan, Ms. Slotkin, for 5 minutes.
Thank you, Mr. Chairman. Mr. Director, thanks for being here, and thanks to you and your workforce for the really unprecedented challenge that we have ahead of us, or that we've been dealing with and we still have ahead of us. I'm glad to see there is wide bipartisan agreement that the idea that we were buying and like over a barrel with the Chinese government and in Asian suppliers on PPE, the fact that I'm negotiating for a 78-cent mask with a Chinese middleman in the middle of rural China means the chickens have come home to roost on manufacturing. And as the state that does the most manufacturing of just about any of them, we've been talking about this since the 80s, not long before this crisis. And certainly because of GM and Ford and what they did to invest in ventilators, we know personally how hard it was to get the administration to use the DPA. I'm glad they're using it now, but we should just acknowledge that it took longer than it should. But if my colleagues are interested in actually doing something to make sure you're not in this situation again in future pandemics, there is a bipartisan bill, Strengthening American Strategic National Stockpile Act, so that we can actually not just use the DPA, which should be an emergency authority, but incentivize American companies to want to make these supplies for you all. So I'm glad we're in strong agreement on that. Let me just ask you about testing. You've briefed us on March 20th, April 17th, May 8th, and again today, and each time, I believe you've said we have the supplies we need for everyone who needs a test. As someone from Michigan, where we went through a really strong, like March and April was where our wave was, and now watching my peers go through this, is it your testimony that since March 20th, everyone who has needed a test has gotten access to a test unless there was a local implementation problem?
Again, I would defer testing specifics and details to Admiral Jawar because he's the test. Again, our role is to enable governors like Governor
Whitmer.
Whitmer, thank you, to run her testing program for her state.
So is it your testimony that you got her all the reagent and all the swabs that she needed for every test that was required by the state of Michigan?
So I can't say 100%, but I can say I can give you details about exactly what we delivered to each state, swabs and media, and if there was and so each, just to step back, through Admiral Jawar and his engagement with states and governors, had engagement with every single state governor about testing and their goals, designed what their testing percentage and goal needed to be by state, and then with supplies, swabs, and media, applied that number to their program.
Okay.
If a governor exceeded their goal, then we had enough slack in the supply chain to give, in this case, Governor Whitmer more. And so again, I have to go back and look at the record about, did she meet her goals or did she exceed her goals?
It does feel like, especially as we look at other parts of the country having the same problems that we had early on, that it feels like passing the buck and we can't just learn from our experience. There is no way that you can still say, as you did on March 20th, that we had all the materials we needed to test everyone that we needed to test then, in April, in May, and now today. We don't have to answer that. It's hard to think ahead to another wave. And that's my next question, sir. No,
again,
please.
but
My next
March
question
20th
is for the state of
was months
Michigan.
away, and so
We're
the
watching
dynamic
our peers
situation.
have the same problems in Texas, in Alabama, in Arizona that we went through. And I'm asking your question as a planner. Are you currently planning for a second wave in the states that got hit hardest the first round?
Are you talking about Chicago, Detroit?
New York, New Jersey, Pennsylvania?
So there is constant planning and strategizing about what the next 30, 60, 90 days look like. That's what we do. Right now, we're looking at, again, what's closest to us in front of us is those 4 states that have 50%.
Wave 1.
Well, it's wave 1.5,
right, 1B.
Right? Because we thought we would have a little lull between July and August, and that didn't happen. So again, we're dealing with what's in front of us right now.
I guess the question is, help me understand and explain to the public that what happened to us with the shortages on PPE is not going to just keep happening again in a second wave for places like Michigan.
Yes, ma'am, and I think time makes PPE better. And we had just recently completed with the Supply Chain Task Force, Emma Polovchek and the team actually went out to every single state, talked to them one-to-one about how much PPE do you have on hand? And I'll just speak in general terms, not every state is equal, but for the most part, the majority of states have 60, 90, 120 days of PPE stockpiled in their state warehouses. That's a really good sign. And I'm not saying that is the ultimate solution. We still have to work on making sure we have enough in the national strategic national stockpile. That's a whole nother initiative.
Totally.
So there's lots to do. We need to ramp up production so we can have bigger numbers. So there's lots of facets to all this, but I think we're in a much better position today than we were on March 20th when it comes to PPE. And again, every day we get a little bit healthier because we've done all these initiatives along the way. And so I have confidence that we'll have enough PPE for today and for if there's a second wave in the fall.
Thank you, Mr. Chairman.
Thank you very much. Chair recognizes the gentleman from Missouri, Mr. Cleaver, for 5 minutes.
Thank you, Mr. Chairman. Thank you for being here, Administrator. I appreciate your presence and so forth. I think it's good, and I know your job is hard. But in April, FEMA published a new civil rights bulletin entitled "Ensuring Civil Rights During the COVID-19 Response." The bulletin went on, to emphasize FEMA's legal and moral obligation to deliver COVID-19 pandemic relief and disaster assistance to communities irrespective of race, color, religion, national origin, sex, and so forth. But in spite of your welcome bulletin on civil rights, COVID-19 disparities remain. And so I'm not saying you're doing anything deliberately, or I mean, I don't even want to even almost suggest that, because I think that would be irresponsible for me. But what I want you to address as best as you can, please, is do you think that the agency is doing enough or the right things that would reduce the disparity between the people of color who are disproportionately affected by the pandemic? What else could you do, is there something you should be addressing, sending to the public, or those who are out fighting this deadly disease?
Yes, sir. Thanks for the question. So I've been a emergency manager for a few years now, about 13 years at every level of government, and what I've learned is that all the challenges a community faces before disaster, whether it's poverty, homeless, unemployment, the disaster, and you can use COVID-19 as the disaster, makes it all worse, and it lays bare where the gaps are. And I think that's where we are in some of these communities. And I understand there's been long-standing inequities in healthcare access, service, and outcomes. But let me tell you what FEMA is doing to try to offset some of this disparity. And again, thank you for mentioning the Equal Rights Bulletin. It's actually the first time we've ever issued one of these for a disaster, and I think probably it's going to be a standard fare. Again.
Yeah, I appreciate that too, sir.
Yes, sir.
Thank you.
56 major disasters on one day, March 13th. So we've never been here before. But we focused on things that are in our authorities and things that we get a demand signal from states. Things like food, help with food. So we have a program where we can use Stafford Act money to provide feeding in a lot of innovative ways. And I'm going to use a couple examples. In California, using Meals on Wheels to deliver food to those that can't get out of their home or COVID positive. We've never done that before. So we want to try to be innovative. Things like housing, homelessness in California, getting them off the street and putting them in a non-congregate sheltering if they're positive, again, to drive down the curve on COVID. Testing sites, 750 or so community-based testing sites today. 70% of those testing sites are in socially vulnerable communities, and that's deliberate. That's not by accident, and I give great credit to my partners at HHS for driving that. So we continue to do those things. Just like everything else, we can do much better, and we look for every opportunity to do so.
Okay, thank you. My final question, and it's personal, but it's not, because I think there are millions of people would ask you the same question if they were here. I have a grandson who is 5 years old and a granddaughter who is 7, almost 7 years old. And I got to tell you, Administrator, I am scared to death for them to go to school in a few weeks. I mean, what can I tell my daughter and my son-in-law? What can I tell my wife? And what can I tell my constituents when they want to know how can schools open safely if they can't get air filters or PPE?
Yes, sir. And I'm gonna use the mitigation fundamentals that work no matter if it's a school or it's here testifying to Congress. It's all the things that matter. And these mitigation fundamentals work no matter where you are. And we've seen that across the country. First is wearing a mask, right? So drive the transmission down by wearing a mask and having somebody that's across from you wearing a mask. And you wear your mask, not for yourself, you wear the mask so you protect the person across from you. So that's one. Next is hygiene and hand washing. very simple things. You know, every time I walk by a alcohol pump, whether I need to wash my hands or not, I do it today, just because it's good habit. Don't wear rubber gloves. It doesn't help with transmission. Actually, it's against, it goes against transmission. So just don't wear rubber gloves. Keep your hands clean. And then social distancing. Stay away 6 feet, and we're all doing it here today. And then lastly, don't go into bars and don't go into crowded places like overcrowded
Yeah,
diners.
but my grandson is 5.
If the American public can do all of those things, we will crush the COVID wave today.
Okay, thank you, Mr. Chairman.
Thank you very much. Chair recognizes the gentleman from Texas for 5 minutes, Mr. Green.
Thank you, Mr. Chairman. Thank the witness for appearing today. Mr. Administrator, you are a former military person, is this correct? Yes, sir. Lieutenant Colonel? Believe in chain of command?
Absolutely, sir.
Respect it?
Yes, sir. It's one of our core values.
Mr. Administrator, I'll come back to this at the end of my questions. But Mr. Administrator, please accept this as a heartfelt statement with no desire to demean you in any way. But you indicated earlier that we will overcome it, and you're talking about the virus. We will overcome it. But Mr. Administrator, at what cost? That's the question. At what cost? Harris County, Texas, according to the intelligence that I have a few days ago, 37,095 confirmed cases, 545 deaths. July 20th, 2020, as it relates to the country I love, the United States of America, 3.9 million cases, 143,000 deaths. At what cost? News article, Texas Tribune, dated July 19th, 2020. 85 babies under 1 year old in Nueces County have tested positive for coronavirus. And this is since mid-March. Then it goes on to say that a baby younger than 6 months old died. At what cost? At what cost? We have a president who has talked about injecting persons with disinfectant, who has indicated that the virus will simply disappear. President who won't wear the mask that you just said we ought to wear. I respect you, and I believe you're sincere. But when the President of the United States of America won't wear the mask that you and I know will protect people and save lives, you have to ask, at what cost? No reflection on you, Lieutenant Colonel. I respect you. I appreciate what you've done for your country. But the question is, at what cost? How many lives? How many more? What is wrong with this man? You and I know that masks protect people, and it's just yesterday that he seems to have come around. Now back to the chain of command. I expect you to do what you're doing, to be quite candid with you. You're a Marine. Once a Marine, always a Marine. You have to do what you do. This is how the country functions. So I appreciate you. But I just want you to know that the cost is too high. It's too high for minorities. It's too high. In Houston, Texas, where I have a community known as Sunnyside, one of the hot spots. Minorities are the people who drive the trucks, they pick up the trash, they bag the groceries. I'm talking about Latinx, I'm talking about African Americans. The cost is too high. This is why I came to the hearing. I want to thank the chairman for having the hearing. And I appreciate what you said because I agree with you. We will overcome it. But the question is, at what cost? And it's a rhetorical question that you need not answer, my dear brother. I hope you're not offended by my saying, my dear brother. There's only one race, human, and we're related. But at what cost? You need not answer. I yield back the balance of my time.
Gentleman yields back his time. Chair recognizes the gentlelady from New York for 5 minutes, Ms. Clark.
I thank you very much, Mr. Chairman, and Administrator Gaynor. I'm pleased that you have joined us today. However, I'm not pleased by the administration's deadly mismanagement of this pandemic. Hundreds of thousands of Americans have died. Countless small businesses have shuttered because of the federal government's failure to address this crisis with the appropriate amount of urgency. And to this day, the urgency has not risen to the level of to meet the level of distress and destruction that this pandemic is wreaking across this nation. I'd like to turn to the strategic stockpile. The Strategic National Stockpile is the nation's supply of life-saving pharmaceuticals and medical supplies for the use in a public health emergency. Throughout the pandemic, leadership of the stockpile has moved back and forth among CDC, HHS, and FEMA. In March, control of the stockpile was shifted from HHS to FEMA, and in late June, control reverted back to HHS. So Administrator Gaynor, could you please describe why control of the stockpile has shifted multiple times, and how does FEMA continue to support the Strategic National Stockpile?
Yes, ma'am. Thanks for the question. Just to be clear, again, FEMA was never, to the best of my knowledge, in recent history, the owner of the Strategic National Stockpile. I think you are correct. Ownership had been between CDC and ASPR. It now resides under the control of ASPR, Assistant Secretary for Preparedness and Response, under Secretary Azar at HHS.
So you don't know, just to be clear, so you don't know why they keep shifting the control of the stockpile between agencies?
I don't, and again, I would defer that question to the Secretary about why those decisions were made.
At a White House press conference on April 2nd, Jared Kushner, speaking about the Strategic National Stockpile, said the notion of the federal stockpile was, around the notion of the federal stockpile was, it's supposed to be our stockpile. It's not supposed to be the state stockpiles that they then use. This directly contradicted the description of the stockpile's purpose on the website. And shortly thereafter, the text on the website changed to better fit Mr. Kushner's remarks. Administrator Gaynor, what is your understanding of the purpose of the Strategic National Stockpile?
Again, not being an expert in the history of it, but from my general understanding of the stockpile that we used today, now we're building the next version of that, next generation stockpile, but as it existed going into COVID-19, it was really it was not designed for a pandemic of this scale. It was really designed for, again, as I understand it, for a anthrax attack in a very small couple cities in the United States. And it was really used.
So my question is, what is the purpose?
The purpose.
What is its usage?
So again, I think the traditional purpose, the way it was designed for, was again a biological attack in a city, and so the stockpile has many different things in it, to include pharmaceuticals and vents and PPE, and it really was and is designed to buy time get that stuff out the door to where it's needed the most until you can ramp up production or ramp up imports. And again, I'm not talking about COVID-19, it's generally in an anthrax scenario. And then you get it through the normal channels. But again, not designed for COVID-19. It could not be used as a single source for all things PPE across the country, and that's one of the reasons. That's one of the reasons we designed the air bridge. We had partnerships with.
Thank you for your response, Administrator. On April 27th, as the virus spread to more than 900,000 individuals in the United States, killing more than 54,000 Americans, Dr. James Mahoney, a pulmonologist, died of complications related to COVID-19. Dr. Mahoney worked for more than 30 years at the SUNY Downstate Medical Center, an underfunded, publicly financed hospital that serves my district in Brooklyn, New York. Dr. Mahoney was set to retire. Then the pandemic struck. Deferring retirement, Dr. Mahoney, as his brother put it, ran into the fire, continuing to care for patients battling COVID-19. Like other hospitals that serve economically disadvantaged communities, the hospital where Dr. Mahoney worked didn't have enough PPE as the virus spread. This occurred back in April. It distresses me to see my colleagues going through the same exact trauma. Here we are, 3 months later, going into the 4th month. Dr. Gaynor, the failure of the administration to provide PPE to hospitals, to nursing homes, particularly those serving economically disadvantaged communities, counts amongst its consequences the loss of many dedicated frontline workers. What specific steps is FEMA taking, if any, to ensure that frontline workers receive the supplies they need to fight the ongoing pandemic?
Yes, ma'am. And again, we are built as an emergency management agency with the primary goal is to save lives and minimize suffering. So with you, I agree that one life lost is one life too many. And so, it's an indiscriminate disease. It knows no borders. It knows no boundaries. It doesn't care what you look like or where you're from. And so just to go back on making sure that we have enough PPE to protect our frontline workers, that has been the goal from the beginning. And to go back on further statements about global competition, not just in the U.S., but across the globe, everyone's looking for the same exact item, like an N95 masks, and we were not managing an abundance of resources. We were managing at FEMA the lack of resources and making hard decisions about priorities about where do these very limited, at the time, very limited resources go to do the best to save lives and minimize suffering. So those decisions were made at the highest level within FEMA. My partners on the Unified Command Group at FEMA, Dr. Jawar and Dr. Kalik, we agonized over all those decisions about where do the vents go, where does PPE go. Again, no small task, hard decisions to make, but our goal was to make sure that we had PPE where it was needed the most, and that remains our goal today. And we're in a much better place today with PPE than we were in March and April.
Mr. Chairman, I know that my time has expired, but this has been an abysmal failure for anyone to try to justify the lack of urgency and the lack of continued preparation for this pandemic across this nation, and to justify by saying that we're managing the best way we can. This is unexpected. We know what we're dealing with now. And this administration continues to fail the American people at the cost of lives and livelihoods. I yield back, Mr. Chairman.
Thank you very much. Chair recognizes the gentlelady from Nevada, Ms. Titus, for 5 minutes.
Thank you, Mr. Chairman. Administrator Gaynor, you know, I represent Las Vegas, and we have a mask requirement, and we closed and then opened gradually, but now we're seeing a spike in cases. So I want to ask you a couple of questions about that. I think you're probably aware that the state of Nevada made a Title 32 extension request. We sent that in on July the 9th. We want to continue to use our Nevada National Guard for the mitigation activities. They've done a great job, and we need to continue that. I have a letter from the governor and an additional support letter from the entire delegation asking for this extension. And with unanimous consent, Mr. Chairman, I'd like to enter these into the record.
Without objection, so ordered.
Thank you very much. Right now, our use of the National Guard is to end in August. And I wonder if you have any idea when we're going to hear from you, when we'll know if that's going to be able to be continued, what the status of that request is.
Yes, ma'am. Thanks for the question. I can't say I've seen that exact letter from Nevada, but we'll make sure that we have that. Many governors, most every governor has asked for an extension past August 21st. We have been discussing that at the administration, DOD, and FEMA, and hopefully we make a decision here shortly, because I think we all know how valuable the National Guard has been in helping governors across the country do many things, heroic things, and as a valuable asset, we want to make sure that we appropriately adjudicate all those requests. So hopefully shortly we'll have a decision from the administration.
Well, I hope it's a positive one, because they have been very helpful, and we'd like to see them continue to do that as these cases increase. My second question goes back to the issue of test kits. We've just been getting mixed responses from the administration in this area, like in so many others. First, we were told that they'd be provided by the federal government. I think the CDC coordinated by you through June the 30th. Then, as July the 1st approached, we got word, and I think Mr. Rose referred to this a little bit, that no, not to worry. Indeed, you would be continuing them through the end of the year to January the 1st. We really need these test kits, and I wonder if you can give me any more specifics. Are they going to be continued? Can we count on that, or do we need to provide our own test kits?
Yes, ma'am. And when you say test kits, and again, I would defer there's different machines with different requirements, and so generically, FEMA is providing testing supplies, swabs, and media to governors. If there's a specific ask from Nevada about a specific kind of kit, I will engage HHS and Dr. Zawad to see if there's a shortage that we need to correct or adjust.
Well, thank you. So it's not cut it off now because we're in July, that we're going to continue to have this relationship.
Yes, ma'am. Yes, ma'am. And production is much greater than it was, 90 days ago.
Well, now for one more, just kind of more general question. Yesterday, I joined some of my colleagues, the chairman on this committee and the chairman on the Transportation Infrastructure Committee, and I have asked you about this before, but I'll ask you about it again, see if the situation has changed. We're very concerned about the number of vacancies at the top level in FEMA, especially as we try to deal with and coordinate and figure out and take charge of what's going on with the pandemic. But on top of that, now we're into hurricane season, and it looks like this is going to be a pretty vicious season. What is happening with these different positions? Are you filling them? Can you not find people? Are you covering it all by yourself? Can you give us some idea?
Yes, ma'am. In general, just on, so a couple different categories of vacancies. So generally, vacancies across FEMA, we have hired in the past 6 months, or actually from this fiscal year from 1 October to now, we have hired 22% more people than we've hired ever before. So we've onboarded more people in the past couple of months than we've done historically, which is a great sign. And we've done that while responding to COVID-19 through virtual onboarding and telework. It's been quite amazing. Vacancies on career SESs. As of today, there is only one vacancy for an SES out of about 105 or so SESs in FEMA. There's only one vacancy that just came up a couple days ago. The rest either have a selected individual or they're in a process of selecting individuals. So again, we've never been in this spot before. We've virtually had no career vacancies. We're pretty proud of that. And then the last category is politicals. And so I think we've lost some politicals. Dan Kanuski, who ran Resilience, resigned early January, as did Jeff Byard, who ran Operations. But let me assure you, we continue to fill political spots. We continue to fill career spots. We continue to do hiring. And again, the pool of talent that I have at FEMA is quite breathtaking. I have no lack of confidence about our ability to perform, respond to COVID-19 or to a hurricane or anything in front of us. We have never been more ready as an agency, and that's a belief I take with me, having worked through COVID-19 response over the past 140 days or so.
So you feel like you have enough of a senior leadership team to make some of these key decisions that we've been asking about through the course of this hearing?
Yes, ma'am. We've been making decisions, and again, where there was a vacancy, we're designed to have deputies, and again, I'll put up any one of my politicals or careers against anyone else when it comes to talent and dedication and enthusiasm for the mission. They have been outperforming even my expectations. So I think we're, obviously we need a couple more politicals, and we'll work on that. But I think as an agency as a whole, we're in a really good spot.
Well, Mr. Gaynor, I know you're a professional, and I think you're doing a good job, but in so many of these agencies, we see people appointed who come to the agency that they've tried to get rid of when they were in Congress, or they come to the agency from an industry that they're supposed to regulate. So when you talk about having politicals, I hope you'll look for experts who know how to handle this problem, and you'll make some policy decisions based on science and good crisis management, and not just on somebody who's a friend or a connection or has a business interest with Mr. Kushner.
Ma'am, I could not speak more highly of the politicals that I work with today. Absolutely talented emergency managers. Never worked with a greater bunch. Whether that they're here now, or that like Dr. Kanuski and Jeff Byard, no better men and women that I've worked with here at FEMA when it comes to politicals.
Thank you, Mr. Chairman. I yield back.
Thank you very much. Chair recognizes the gentlelady from New Jersey, Ms. Watson Coleman, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Gaynor, for your testimony today and for the hard work that you all are doing. I want to share some information that I have. Because we've talked about the fact that we're at this place and we are doing the best we can trying to catch up with things as we move. But the understanding I have is that we had an indication that we had a problem as far back as November of 2019. And even though the president refused to deal with any of this information, we knew that this was coming, and we knew that he was given this information even in his daily briefings as early as January. I also want to take note of the fact that there were independent research studies done, one by Columbia University and one by another organization, that said, had we implemented social distancing guidelines as far back as March 1, we would have possibly decreased the death rate from COVID between 80 and 90%. So it is not like we didn't have earlier information upon which to act. And I know that my colleagues on the other side have asked you questions like, are there the appeals to panic and recriminations, is that in any way having an impact on how our citizens are reacting to the space in which they live right now? And what about the confusions that may have been shared between what the experts are saying and what the administration is saying? Well, my question is, well, how about the conflicts and the lying that have been shared from the White House and the head of the task force, the Vice President of the United States? You all said that you make your decisions based on facts and data, your data-driven decisions. So I want to ask you a couple of responses to things that the President of the United States has said, and you tell me whether or not they are or are not true. On May 8th, the President said that coronavirus, and I quote, will go away without a vaccine. Mr. Gaynor, yes or no? Is that true?
Something about a vaccine. I didn't hear your whole question.
On May 8th, the President said that the coronavirus, and I quote, will go away without a vaccine. Is that yes or no? Do you believe that, yes or no?
Again, ma'am, I think the administration is working hard to identify.
Do you believe that this is going to happen? I'm not asking you to defend the administration with this incompetence. I want you to answer my question, yes or no, or I don't know.
Well, yes, ma'am.
Yes,
But
no,
again, I think
don't know.
this question deserves more than a yes or no answer. And again,
I don't
if
really
you just
care what you think it deserves. This is my time that I am reclaiming, and I need you to say yes, no, or I don't know.
Yes, ma'am. What I would like to say is that the administration works hard to identify therapeutics and vaccines. NIH.
All right. So then, are we going to acknowledge the fact that it needs a vaccine? Moving
yes, ma'am.
Forward.
The administration,
June 17th,
NIH, early on, within days
Gaynor,
ago.
I reclaim my time from you. I reclaim my time. On June the 17th, President Trump said the coronavirus is, and I quote, dying out. Is the coronavirus dying out right now, Mr. Gaynor? Yes or no?
Well, I think if you look across the country, it ebbs and flows. You know, the epicenter in March and April was
ebbing and flowing, but
the
is it
epicenter
dying
was
out is my question.
was in New York and New Jersey, Detroit, Chicago, Los Angeles, Washington State, and now
we're seeing
it's
spikes
a
all
little
over,
bit.
particularly in the West and in the South. So is the answer to that question yes or no? Why are you finding it so difficult to say what you're seeing, yes or no?
Because again, ma'am, I think your questions deserve a answer that's just
really
more
don't
than
care
yes
what
or
you
no.
think.
Because
I don't
I'm trying
care.
to. Well,
Let me
you know,
just ask you this
ma'am,
question.
I'm just here trying to share
At
the
one
facts
point,
as I know them.
At one point, the President of the United States said, anybody that wants a coronavirus test can get a test. Is that true? Can anybody that wants a coronavirus test get one right now?
Well, I'll tell you my own experience. I was just on the Gulf Coast.
Is that a yes or no? You're at the head of this outreach and support to the states and the communities. You know the answer to the question.
Well, I'm trying to give you a real life example. I'm just trying to give you a real life example. I was on the Gulf Coast last week. I traveled to Louisiana. I traveled to Michigan, to Mississippi, and I traveled to Alabama.
If you're going to refuse
I came
to
in
answer
contact
my
with
question, this is almost a futile interaction between you and me. Let me just put one more question out there, and you can say whatever you want to say with the little bit of time I have left. Because the President said on June the 8th, so we want the continued blanket lockdown to end for the states. We have some embers or some ashes, or we may have some flames coming up, but we'll put them out. We'll stomp them out. We understand this now. We'll stomp them out, and we'll stomp them out very, very powerfully. Have we stomped out these embers or ashes of the coronavirus?
Ma'am, I'm sure that you can see through across the nation there are hotspots, places like Florida and Texas, Louisiana, Arizona, California that have flared up. And if you look back to March and April, to New York, New Jersey, Connecticut, Rhode Island, those states have it under control. So again, this is a dynamic situation. It changes from day to day. Mitigation works.
And it requires leadership. Yeah. Thank you, sir. This requires leadership, no question about it. And we're doing so well in New Jersey because my governor saw it spiking up just a tiny bit, and he delayed the opening of certain businesses. So we definitely need leadership, something that we've not had from the President of the United States. And let me just say in closing, and Mr. Chairman, I'm going to yield back. When I listen to where you are, and when I listen to what FEMA's had to deal with, when I've listened to how this country in general has this leadership has responded to this pandemic and failing to keep our hundreds of thousands and even millions of citizens safe or alive, I don't believe that you're ready for both the coronavirus that's going to take place during the hurricane seasons and the states in which we're going to have these devastating seasons. And I want to say to you that you need to ask for what you need. You need to understand what you need, which I think you do, Mr. Gaynor, but you need to be bold enough to ask for it, and you need to be bold enough to let us know whether or not you're getting it. And with that, I yield back. Thank you.
Thank you very much. Chair recognizes the gentlelady from California for 5 minutes, Ms. Barragan.
Thank you, Mr. Chairman, for holding this important hearing. Administrator, when did you get involved with FEMA in addressing the coronavirus? Was that roughly around the end of January?
Are you asking when did FEMA get involved with the virus response?
When were you brought in to help FEMA with the coronavirus response? What month was that in?
So we had been partnering with HHS early February, and then
Early February.
and then
Okay,
on
thank you, sir.
and then on 10 February.
Sir, you've answered my question. I really appreciate that. I have a series of questions I want to get to.
But I
Thank
just
you.
like
So
I just like to
roughly-
more fully answer it. So we were in support of HHS on 10 February, where I sent over 30 FEMA experts in logistics, planning, coordination,
Mr. Administrator, my
external
question's about
affairs to
March.
support
Thank you.
HHS's response.
I want to reclaim my time.
She's fine with your answer. She's fine with your answer.
Mr. Administrator, thank you. So roughly in February. In March,
February 10th,
you
exactly.
no, I understood. Thank you, sir. So my question is about March. In March, the U.S. government found 1.5 million N95 masks sitting in a warehouse in Indiana. And the Department of Homeland Security had to decide what to do with these masks. Did you play any role at all on where these masks would go?
Yeah, I'm not familiar with this story, ma'am.
Okay. Well, in March, Homeland Security had 1.5 million N95 respirator masks. They had to decide where to go. The Department of Homeland Security did not send them to the hardest hit hospitals and frontline workers across the country. At the end of the day, they decided to send these masks to TSA and CBP and other places instead of our hospital workers and our frontline workers that really needed it. Very unfortunate. And I was hoping to hear that you, who was at FEMA, would have advocated to have access to those masks and had advocated to have those go to our hard-hit hospitals.
Although
Okay,
I'm unfamiliar with this story, I would say that
she hadn't
I'm going to
finished.
reclaim my time.
She hadn't finished answering her question. Asking her question.
Okay. Mr. Administrator, I'm going to move on to FEMA's help with California on housing. First of all, I want to thank FEMA for working with California on providing housing and those who really needed shelter during COVID-19. Now, FEMA has committed to reimburse 50 to 75% of expenses for shelter and temporary housing through the Public Assistance Program Category B. One of the problems, however, is FEMA is waiting way too long to let the state know whether that program will continue to be funded, so they can't plan for the next month. Is there anything FEMA can do to speed up the process in letting the state know whether the funding will continue, so they don't get left with a large bill and not having the assistance of FEMA?
Yes, ma'am. And I don't know the specifics of this, but to date, we have obligated $1.1 billion to California. I'm not sure where the holdup is on getting that money out the door from the state. We run our programs on reimbursement, so you actually have to spend money before you get money from the federal government. So if there's a specific locality issue, I'd be happy to connect with you and your staff on that item.
Okay, I will follow up. Thank you. There are instances where local governments have been waiting for years to receive FEMA reimbursement, so I definitely will follow up. It doesn't sound just at all, and states need to be able to plan on when FEMA is going to continue the partnership. Mr. Administrator, conventional disaster response strategies such as congregate sheltering and voluntary recovery and supply distribution efforts require re-examination during the pandemic. Administrator, how is FEMA working to prepare sheltering guidance with the need for individuals to socially to have social distancing? I'm sorry.
In the beginning of my testimony, I shared with everyone that FEMA created the COVID-19 pandemic operational guide for the hurricane season. Although it has the title hurricane on the front cover, it can be applied to any natural disaster or any incident because the lessons in there apply to all of it. So things like more space for sheltering. And so having been a local emergency manager for almost 7 years and then a state director, the responsibility for managing sheltering is on the local official. The local mayor owns that responsibility. Again, I go back to how this system of emergency management works. Locally executed, state managed, and federally supported. We provide technical assistance if needed to states and locals if they need extra planning considerations, but the guidance is out there. It's best practice from many different agencies to include CDC and ASPR about how to adapt your traditional, and I'll use sheltering challenges to COVID-19 response. So those resources are out there. There's actually an exercise program where locals can test their plans to make sure that the assumptions that they've made for dealing with COVID-19, again, for sheltering or evacuation, holds up when actually put to use. So that's how the program works.
Well, thank you, Administrator, for your attempt at answering questions. It has been a little frustrating in your inability to provide specifics or to answer questions directly. We have seen that you and FEMA were involved in February. The number of deaths were not very high at that time. And because of this Trump administration's failure and really the failure across the board on the lack of leadership has led to over 135,000 Americans being dead. And that is just not a flare-up in certain parts. That's in continued failure and not having a national strategy. With that, Mr. Chairman, I yield back.
Thank you very much. Chair recognizes the gentlelady from Florida for 5 minutes, Ms. Dimmons.
Thank you so much, Mr. Chairman and Administrator Gaynor. Thank you for being with us today. I also want to begin by thanking you and the men and women who work with you for the work that you do every day to get us through some very tough times. But I have to say that this has been pretty exhausting for me. As a first responder, I've worked out in the field with FEMA on many occasions. And to listen to my colleagues on the other side of the aisle, I would think that this would be one of the areas that we could get our act together. But to hear my colleagues on the other side of the aisle focus more on defending the inaction of our president than on the 141,000+ Americans who have lost their lives to COVID-19. I was also pleased to hear them say that facts matter, that solid facts based on data are important, because we know that the president is the biggest offender in that area. This administration, unfortunately, is always looking for a villain to blame. America's response could have been better had China allowed us to have a better response. But then as we look at other countries, somehow other countries were able to find their way to being better able to control the virus and save more lives despite China's actions. Administrator Gaynor, how would you explain that?
Yeah, I'm not sure I understand the question, but what I can tell you from my point of view is my job in the role of leading the federal coordination for operations is to make sure that the full weight of the nation, all departments with all the things that they bring to the table, like DOD and the National Guard and HHS, we maximize those again, and I've said it time and time again, to prevent loss of life and suffering.
I believe
my
right,
role
to prevent loss of life and suffering. You said earlier to protect the lives of the American people, the health and safety of the American people. Is that what? That's what you said, right? How do you do that?
That's what I just said.
Not what your job is, but how do you protect the health and safety of the American people?
In many different ways, and I'll use.
Just give me three. How do you do that as we respond to COVID-19? How do you, as the FEMA administrator, protect the health and lives of the American people?
So the first example I'll give is the initiative to create more ventilators in the United States. So when we first took over operation coordination, in the stockpile were about 16,000.
So to create more ventilators.
But I just like to tell the success of the story.
Administrator Gaynor, let me.
16,000 ventilators, and today we have almost.
What's number two? It's so equipment.
We almost
Make
have
sure that there's enough
1,000
equipment.
ventilators.
What's number two?
And by September, we'll have 110 ventilators in the stockpile by September.
Okay, you said that
8 times more
that
ventilators.
this
than we
was a
did
global
to start.
competition for personal protection equipment. Is that not correct?
Absolutely.
Okay, but yet we've seen bidding wars between states, the federal government, and other countries. Since this is a global,
I disagree with that premise.
Since this is a global competition, isn't that the reason why we would need a federal response in terms of, as opposed to allowing states to basically fight for themselves or fend for themselves?
Again, I think, having been a state director, I think I would do the same.
Well, you've worked at the local, state, and federal level.
So just using my experience at the local and state level, I think one of my goals is, and we'll just talk about PPE, is to get as much PPE as I could, even if I didn't need it, just to make sure I had enough because I wasn't sure what was going to happen next. And so my role, and again, at the direction of the president and direction of the coronavirus task force,
since you made the decision to leave it to local jurisdictions, has FEMA taken the initiative to look at best practices?
Bring it back to the United States.
Has FEMA taken the initiative to look at best practices through any states who are doing it better than others and maybe give guidelines to states who were struggling?
We have. We've engaged, and maybe you missed it earlier, but we've engaged with every single state when it comes to PPE.
But have you developed, you've looked at best practices,
we
some
always
states
look at
doing
best
it better than
practices.
others,
We always
and
do after
presented
action.
guidelines to states that were struggling.
Absolutely, absolutely.
Okay. Finally, Mr. Gaynor, let me just say this. I am from Florida, and you know the situation in Florida. Yesterday, we added 9,400 new COVID-19 cases. And so based on your many years of emergency management experience at the local, state, and federal level, because I heard a conversation earlier about people panicking and all of that when the president uses fear every day to keep my colleagues on the other side of the aisle from doing their jobs and others. But anyway, what message would you send to Florida when we look at those numbers and what's going on in Florida, Texas,
and I'll go back to the fundamentals. Mask work, right? Wear a mask. Don't wear it for yourself. Wear it for the person that's across from you. Keep your hands clean. Every time you walk by a alcohol dispenser, clean your hands. Don't wear rubber gloves. It doesn't help. It actually makes things worse. Stay out of bars. Stay out of crowded restaurants. And use social distancing. If we do all those,
and finally,
if you do all those four things,
Administrator,
if every American does all those four things,
if we look at the nation's overall response to COVID-19, what grade would you give?
Yeah, I don't do grades. You can historians and after action reports can grade me.
But you do feel like you have done a good job, and the nation has done a good job responding to
So
COVID-19.
I think all the hard-working career men and women.
We know they work hard. We know they work hard.
FEMA,
but when the
and
murder rate was high in my city, I
other,
did not celebrate until the numbers went down. Do you believe
I'm not celebrating. I'm just telling you about the hard work that everyone has done, and the hard work continues.
Chairman, I yield back.
Gentlelady yields back. Chair recognizes for submission to the record, gentlelady from Texas.
Mr. Chairman, thank you for your kindness and indulgence and making mention of Tony Robinson of Region 6. I want to submit into the record for his work the Texas Division of Emergency Management State Situation Report that shows the increasing number in Texas. ABC News, 13 states now report coronavirus testing issues in echo of early troubles. That's Texas unanimous consent. Texas Medical Center talks about the lack of beds and ICU and staffing, as unanimous consent. Dr. Peirce, Emergency Management of City of Houston, begging for the extension of National Guard and more testing again in the state of Texas in Houston. Trump article, July 20th, Trump said more COVID-19 testing creates more cases. We did the math. And of course, the final documents, COVID-19 cases due to increased prevalence. And then this is on the website in Texas. I'm going to work with them about it. But it tells people that they have to pay, and that discourages people. I ask unanimous consent for that to be in the record. And thank you, Mr. Chairman, for your indulgence. We're fighting to save lives. I yield back.
Without objection. Chair recognizes the gentleman from Mississippi for 5 minutes, Mr. Guest.
Thank you, Mr. Chairman. Mr. Gaynor, I want to thank you and the men and women that serve under you. In your written testimony, you talk about the fact that y'all are doing a very difficult job in really unprecedented times. You say that we are currently under 114 concurrent major disaster declarations, one for every state in the union. 5 territories are also under major disaster declarations. You also talk about the Seminole Tribe of Florida and the District of Columbia. I know in mine, the chairman's home state of Mississippi, that there have been 5 federal declarations since January of this year. We currently have a pending declaration that we're working on approval on that. And I know you had the chance to visit Mississippi last week to meet with our governor, meet with some of our first responders, and discuss some of the unique challenges that we're facing. One of those challenges is an upcoming hurricane season that all the states along the Mississippi, along the Gulf Coast as a whole are concerned about. And those challenges in the middle of the COVID-19 pandemic. So could you just take a few moments to kind of share with this committee some of the things that you share with our governor about those upcoming challenges and what FEMA is doing to prepare for the challenges that lie ahead?
Yes, sir. Thank you, sir. It was actually a great visit in Mississippi. We got to travel with the governor around the state, mostly across the Gulf. To visit fire departments, talk about grants and preparedness. Really fantastic day. So I thank him for his hospitality, along with the Emergency Management Director, Greg Michelle. One of the things that we wanted to check on this season is obviously, how have states adapted their existing plans for things like evacuation and sheltering using the guidance that we have provided back in May, and how have they adapted. And so we wanted to go down there and take a temperature check to see how it's all going. And so this year is going to be a year like we haven't had before, because when it comes to simple things like ordering an evacuation, it's going to take more time. If you need transportation, it's going to take double the transportation. And if you go to a shelter, maybe it's going to take double or triple the shelter space. And how have locals and states and counties adapted to that? So it is a challenge. I want to report I'm completely impressed by all the effort that Mississippi Emergency Management has done, and the dedication of the governor to make sure that it's a priority. So it's always a moving target, right? You always got to do more, and the clock is running against you. So I encourage all my emergency managers across the country is prepare now. You don't know what the next thing is to hit you, so whether it's a hurricane or flooding or a fire, use this time now to prepare to respond while also responding to COVID-19. That's kind of the message. That guidance is available online. We put it out in May and made a big announcement, and so we encourage all states and locals, tribes and territories to embrace responding to a traditional disaster while responding to COVID-19.
And wanted to ask one specific question as it relates to COVID-19. On page 5 of your written testimony, there's 2 paragraphs there that are titled Managing Worldwide Critical Shortages, and we talked a little bit about global competition. You state there in your written testimony from the outset, a key element of FEMA's response had been managing shortfalls of medical supplies, and you go on and give a list of those supplies, and then you say we have been further challenged as most of the manufacturing for PPE occurs in Asia. I know that the Wall Street Journal recently reported that prior to the COVID-19 outbreak, that China exported more respirators, surgical masks, medical gloves, and protective garments than the rest of the world combined. And so my question to you is, how big of a challenge has it been, the fact that many of the items that we are in need of today are not manufactured in our country, that China has, if not the exclusive, manufactures the large majority of supplies worldwide as it relates to medical supplies, critical drugs and things that we need. How big of a challenge has that been, and does Congress need to focus our attention going forward on enticing those manufacturers to return to the United States so that those items are produced here?
Yes, sir. And I said previously that we have to look at the shortages we've had, and I use PPE as an example, as a national security issue. And maybe today it's a pandemic, but maybe tomorrow it's something different that requires N95s or another critical item that we today rely on another foreign power to provide to us. And maybe when the time comes, they'll be unwilling to do that. And so we need to take a critical look on a host of different items that are produced overseas and connect them to our national security. And I know there's lots of efforts going across government. DOD and Defense Logistics Agency are great partners and help us bring manufacturing back to the U.S. or entice U.S. manufacturers to expand their product line or change their product line. The CARES Act provided $1 billion for a lot of these initiatives. That's only a start, and we need to think long-term, because I think what we do historically is we will put a lot of money into it, and it will last a couple years, and maybe that business struggles to survive because the U.S.-made mask is $2 and the Chinese mask is 70 cents, and you know how the American public is, and about I want it cheap and fast, and maybe that's where it goes. So we need to support our industrial base in the U.S. to make sure we can do this for the long term, and again, take a holistic look about all those items that are important to the U.S. national security.
Thank you, sir. And Mr. Chairman, I yield back.
Thank you very much. The chair yields back. Mr. Gaynor, before we close the hearing, as you know, I've sent numerous letters to you around this topic. And before we adjourn, I need your commitment that all outstanding correspondence to you relative to this pandemic and any other issues by this committee will be answered.
Yes, sir, you have my commitment, and I think we talked previously about it. Unprecedented requests for information from many different people, members of Congress. So we are working through all of them, and some of the challenges, and I'm not trying to give an excuse, but some of the challenges, some of the information that you and other members are looking for reside in other agencies, and so trying to get that information cleared and up to you takes a little bit of time, and we are still responding. So again, we're trying to balance response and all the other things that we must do. But I commit to you today that we will answer all letters fully.
Within, and you give us a period
well, I mean,
of time.
I think there's a backlog of letters, and so I think I'm trying to answer the oldest ones, first, and then as we work through that pile, we'll get to answering. But I mean, we're answering letters every day. It may not seem like that, but we do get them out the door. And again, unprecedented requests for information, 300 or more letters from members of Congress, and we want to make sure we answer those thoroughly. And again, that information and some of those requests come from other agencies. So there's a back and forth.
Well, there are just a couple committees of jurisdiction that I think would have priority for your response, that I hope you'd give it. Some of the responses are several months old. So that information you have, just send that and say, look, I'm trying to get the rest, but just not send anything else.
And I think we just did that. We answered some. It may have been incomplete, but I think we tried to get what we knew and out the door, and so we'll continue to do that.
Well, I'm glad you mentioned that. We just got a letter from you Monday, and it had no documents that we requested. So I think you need to either talk to your team and say we need to do better, because we're trying to do oversight.
Yes, sir.
And in that role, we can't do it without the information, and we're just trying to get the information.
Loud and clear, sir. Got
Thank you. The other issue is, for a lot of us, 140,000 Americans have died. That's a a god-awful number. And I think we are positioned for that number to go higher. But a lot of members have come to the committee and said, it just appears that we could do more to mitigate so much of what's going on. The wearing a mask, the social distancing that we're practicing here today, a lot of things, but it's the clear and coherent and consistent message that I think we need to get from everybody. That's from the White House to that reservist that worked for FEMA in the field. And it's when we don't get that clear, consistent message, we have a problem. And I thank you for your service, but that 140,000 deaths is nothing any of us can be proud of. We have to address it. So I thank you for your testimony and the members for their questions. The members of the committee may have additional questions for you, and we ask that you respond expeditiously in writing to those questions. Without objection, the committee record shall be kept open for 10 days. Hearing no further business, the committee stands adjourned.